Okay, well, I'm going to go ahead and start. Good morning. I'm Kathy Bush. I'm the chair of the School Mental Health Advisory Council, and I'm going to call our December 8th meeting to order and welcome everybody. From what I can see, we've got about 26 participants on, so welcome everybody, and good to see everybody by Zoom today. As you can see, we've adjusted our schedule a little bit today, and we are going to till noon. We had a few items that weren't ready for presentation yet today, so we did make some adjustments to the schedule. And Zoom seemed appropriate for today. Of course, with the weather in northern Kansas, maybe that is truly appropriate for today. So not too bad down here in Wichita. But glad to have everybody here today and hope you're having a good pre-holiday season. Have Christmas coming up pretty soon. So, and I also know that a lot of folks are dealing with a lot of illnesses in their schools. It seems to be a rather prevalent occasion going on right now. So hopefully folks are getting through all of that, or what I guess they're calling the triple-demic right now. So hope you're getting through that okay. Again, call to order, and I would ask Kayla to do our roll call. So when she says your name, you can unmute and say here, and we'll know that you're with us. And I know some people are going to have to drop off for some meetings, and some people are going to be coming on. So we'll have a little bit of folks in and out of meetings. So Kayla, if you do the roll call.
Okay, perfect. Good morning, everybody. Kathy Bush.
Present.
Jean Clifford.
Here.
Dr. Jane Groff.
Here.
Samantha Brown. Shelby Bruckerhoff. Tracy Chauvin. Jose Cornelio.
Present.
Misty Zarnowski. Sherry Domelin. Diane Jerstead.
Present.
Lori Hattrip or Sherry Blanchett. Marsha Westman. Gary
Tracy Chauvin is on now.
Oh, perfect. Thank you. Gary Hinault.
Present.
Jessica Lane. Lori Marshall. Do we have Leah Hawley or Leslie Gerard? Tamara Huff.
Good morning, I'm here.
Dr. Ken Huey. Kimber Katzitz. Mallory Keefe. Kathy Ko. Monica Kurz.
I am standing in for Monica Kurz today. I'm Meg Hasselman.
Okay, welcome, Meg. Lori Marshall or Sue Moran. Scott Engelmeyer.
Here.
Dr. John McKinney.
Present.
Kathy Mosier. Monica Moran. Dina Novak. John Epley. John Dahl. Kimberly O'Connor.
Morning, present.
Judy Rodman. Melanie Scott.
Here.
Shirley Scott.
Present.
Idalia Schumann. Rochelle Sodden.
I'm here.
Dinah Sykes. Mark Tolkelson, Kelsey Torres,
Here.
Ryan Vaughn, Julian Walker, Pam Weigand, Holly Yeager, Janie Humphreys,
Here.
Jamie Dover,
Jamie said he'd be on and off.
and then Bert Moore, Barb Depew,
Present.
Kent Reed,
Here.
Carrie Haig,
Here.
John Calvert,
Good morning. I'm here.
Shanna Bigler,
I'm here.
and Angie Brungart.
I'm here, driving, but here.
Perfect. Did I miss anybody this morning?
I know, I think a few people popped on, so if you didn't hear your name called, why don't you unmute and tell your name so Kayla has your record of your attendance.
Kathy Mosier, Family Service and Guidance.
Thank you, Kathy.
I heard somebody say it for me, but Tracy Chauvin, School Social Workers, and then Casey KPS.
Cherie Blanchett, School Mental Health Initiative.
Brad Gerard, Families Together, and I think Leah Holly's name was mentioned. She'll be popping in and out today as well.
Anybody else?
I'm Scott Johnston, and I'm here with my colleague Ann Ella Fritz. We're from KDHE.
Thank you.
Good morning. I wasn't sure if you wanted guests.
Oh, you're welcome.
Thank you.
Okay, well, thank you very much. Appreciate you all on. And as I mentioned earlier, some people will have to be on and off with other obligations coming up, and we certainly do understand that. We appreciate you being able to be here as much as you are. At this point in time, I'm going to ask for approval of the agenda for today. And again, this was amended from the earlier one. Kayla sent this out, I believe, this morning. And it is a 9 to noon meeting today. So do I have a motion for approval of the agenda? Appreciate you all on, and as I mentioned earlier, some people will have to
Good
be
morning,
on
Kathy.
and
This
off
is
with
John
other
McKinney.
obligations
I
coming up.
move that we approve the agenda.
Okay, thank you, John. Do we have a
Tracy
second?
Chauvin, second.
Thank you, Tracy. Somebody may need to mute. I hear some background noise from somebody. Okay, thank you. Okay, we have a motion and a second to approve the agenda. Kayla, did you get the people? It was John McKinney and Tracy. So there is a agenda item for you to choose yes or no and click your preference and then hit submit. Okay, we have approval of the agenda item for today, so thank you very much. And we will go on to approval of the minutes for the October 13th meeting. And that was a hybrid meeting. We were in Topeka, some of us, and then some of you were online. So do we have a motion to approve the minutes for October 13th?
This is John McKinney. I move that we approve the minutes from our previous meeting.
And thank you, John. Do we have a second?
Dahlia Schumann, second. Shirley
Scott. Dahlia Schumann seconded. So we had a motion for approval by John McKinney, a second by Dahlia Schumann. So the poll will pop up. And if you'd make your choice and hit submit, please. Okay, we have a motion that approved the minutes from that October meeting. Thank you very much. Kayla, do we have anybody signed up for public comments today?
I have not received any at all.
Okay. So seeing as no public comments today, we will move to the next agenda item, which is scheduled at 12:15 and we're at 12:12. It is an overdose dashboard. Scott Johnson and his team look like they're going to present this. So Scott, are you with us today yet?
Yep, I'm here.
Okay, great. Turn it
Hello,
over to
everybody.
the team.
Yeah, so as you mentioned, I'm Scott Johnston. I'm the drug overdose epidemiologist with the Kansas Department of Health and Environment. I'm here with Ella Fritz, our section director, and I'm going to be going over some data in a few minutes, but first I wanted to let Ann introduce herself and talk a little bit about our program, and then I'll go through the data, and then we'll be happy to take any questions. So I'll turn it over to Ann.
Thank you, Scott. Good morning. My name is Ella Fritz. I'm a section director at KDHE, Kansas Department of Health and Environment, in the Bureau of Health Promotion. We have a standalone section which is intended to address substance use disorder prevention and overdose prevention specifically, as well as other drugs of concern. So currently we administer a CDC funding opportunity called Overdose Data to Action. And we are in the 4th year of that opportunity. And part of the work includes what Scott will be talking to you about today, which is surveillance of overdose death and improving and understanding the data that we collect about Kansans so that we may use that data to inform interventions to hopefully decrease morbidity and mortality in relation to substance use disorder. Just really quickly, what I will tell you is that the reason we're thrilled to be able to talk to you today is because sadly, recently, we are watching overdose death happen at an increasing rate and among a younger population. And so, you know, while substance use disorder is a very old problem, we are seeing some changes in the demographics, which necessitate our chatting with you so that we may build new partnerships, so that you might help us with strategic planning about how to address these problems in our communities, because we know Topeka is not the same as Atchison, where I'm at, or, you know, Marion, where maybe somebody else on the call is at. So just really quickly, Scott has some excellent information. I am not an epi at all. I am more on the prevention side. So I will put my email in the chat, because what we'd like to do is hear from you in case you think we might be able to partner on some of this work. We will be writing a new application for like OD2A 2.0 in about March or April of 23. So we are looking for partners to advance the work to prevent, reduce the harms related to opioid overdose, stimulant overdose, and other drugs of concern. Thank you so much.
Thank you. And I'll ask Scott and Ann, would it be best if people have questions that they just put them in the chat and then we'll be able to address them? I'm guessing maybe you want to complete your presentation first.
Yeah, that'd be fine.
Okay,
yeah, just
so
put them in the
folks,
chat to keep track of them. Yep.
yeah, folks, if you've got questions as we go, just put them in the chat. I'll kind of try to keep an eye on that also. And then we're at a point where we can take questions. We'll be able to go back to the chat. Okay, great. Thanks, Scott and Ann.
All right, and I'm gonna share my screen. It says it's not letting me at the moment, but I think if whoever's sharing stops for a moment, it'll let me. Yep, okay. All right, can everybody see this page here with the charts on it? Okay, so this is our new overdose dashboard that's been live on the website for a couple months now, updated with data from 2005 all the way to 2021. We'll get the 2022 data sometime this coming summer. So this is the most recent death data that we have at the moment. So I'm just going to go through this briefly, and then I'll put the link in the chat as well. So this can be, you could view this at any time. And in the coming months, we're looking to add some new tabs with new analyses on them. So this first tab here is the statewide, all across Kansas, deaths by year. And you'll see here, this orange line is the number of deaths per year, with as well as the percent change by year. So back in 2005, there were 241 drug poisoning deaths across all drug categories. And then as you'll see, it kind of has just very slightly increased steadily over the years up until about 2018 or 2019, when it really took off a lot steeper of a rate of increase. And you'll see from 2019, when there were about 400 deaths, it went up to 477 in 2020, and then it increased another 42% to 678 in 2021. And we're not really expecting that to, we're expecting that to probably be potentially even higher in 2022 based on what we're seeing so far. So the problem is getting worse. And if you come on here, you could see these check boxes over here, and you could look at different categories. So kind of what prompted me to be invited here to this meeting was a data request on youth and fentanyl overdoses, because as I'm sure many of you have heard in the news, fentanyl is one of the main drugs of concern due to the increased availability of that in the country. And so here, there's a drug you'll see called synthetic opioid as the category. That's the category that includes fentanyl. So you'll see here, as a fraction of the total deaths, initially from 2005 to about 2019, it stayed fairly steady as well. But from 2019 to 2020, it more than doubled from 70 to 161. And then it more than doubled again from 161 to 347, making up nearly half. I'm not sure the exact percentage off the top of my head, but nearly half of the total number of deaths in Kansas for 2021. So that's just something I wanted to share with you from this tab. And then I'll show you the rest of these tabs as well. So here's the county analysis of deaths. And you'll see here there's coloration of the counties as well as these gray circles overlapping over the top. The coloration is the rate of death, so the number of deaths divided by the population of that county, allowing you to compare the small counties with larger counties more accurately. And then the gray circles are the total number of deaths put on top of that. So you'll see the larger circles over the more populated counties typically. And this is a 10-year average, which allows us to show you the data for the small counties as well as the large ones. Because some of our smaller counties, especially out west, will have so few deaths from year to year that we have to suppress that data for confidentiality reasons. But if we add 10 years together, we can show you more of the information. And then down here, you'll see the same information. It's the counties ranked from highest rate of overdose death to lowest rate, with this orange bar representing the average for the entire state. So the counties to the left have a higher rate of overdose death than the average, and the counties to the right have a lower rate than the average. Once again, you can shift this for whichever category of drug you're wanting to look at. So if we click synthetic opioid, it shifts the data to just look at those deaths, which includes drugs such as fentanyl. Then I'd like to show you this tab here. This is, instead of death data, this is looking at emergency department visits. So you'll be able to see here, there's two layers as well. There's the colors of the county, which just shows the general trend of overdose emergency department visits. So if it's an orange colored county, then for the month that you're looking at, right now we have March 22 through October 22, so more recently. If it's colored orange, it means that the county is trending upwards in ED visits compared to the previous 3 months. If it's blue, it means the county is trending downwards, and there were fewer than the previous 3 months. And if they're gray, then there is no significant difference. They maybe were close to what we've seen in the previous 3 months, or there wasn't much of a change. These red circles layered on top of that represent clusters of ED visits for the drug that you're looking at. So combining those two together, you could kind of see which areas from month to month are seeing increases or decreases in people who are going to the emergency room for an overdose. And then this tab here finally looks at age and sex rates of drug overdose. And you'll see here, this is where some of the more applicable data for the schools and for younger age groups can be found. So you'll see here for 2021, if you hover over these bars, right here for age group 5 to 14, there were 0 deaths in 2021. For lower than that, which would be 0 to 4, nothing's popping up because it was suppressed, meaning there were less than 6, but more than 0. Those are typically going to be, when it's that young of an age group, it's typically accidental, like a child getting into medicine that wasn't secured or something like that. And then, as I said, 5 to 14 had 0 in 2021. And then 15 to 24 age group, there were 67 drug poisoning deaths. So if you look back in the years 15 to 24, 63 were in 2020, 30 in 2019, and 29 in 2018, and so on. So doubled from 2019 to 2020, and then has increased a little bit more from 2020 to 2021 in terms of all drug deaths. If you look at synthetic opioids, which is where this gets fairly interesting, or especially interesting, the 15 to 24 age group has 59 deaths, which, if you'll remember, for all drugs, it was 67. Yeah, 67. So it's about 80 something percent of the all drug deaths were related to a synthetic opioid such as fentanyl. And that's kind of increased over the past several years. I have on a separate tab here that I'll just read off to you from looking at age groups 0 to 24. So in 2017 and 2018, synthetic opioid deaths made up less than 20% of the total deaths for that age group, of the total overdose deaths for that age group. And then in 2019, synthetic opioids made up 37% of the deaths for that age group. And then in 2020, 67%. And in 2021, 88%. So each year over the past 5 years, the percentage of the deaths in that younger age group due to a synthetic opioid such as fentanyl has increased. More of them are involving some of those synthetic opioids that we're seeing cropping up across the country as well as in Kansas. So one more thing to note, this, if you look up here, you'll see the median age of death, meaning this is the number where half of the deaths will be below that number, half the deaths will be someone who's aged older than that number. So all drug, it's 40, meaning that's the median age of that death. And then if you look at synthetic opioids, it decreases down to 34. So we're seeing the age demographics change over time, and we're seeing a higher percentage of synthetic opioid deaths in our younger people. So I wanted to share this dashboard with you guys. If you ever have any questions about this type of data, there's a bunch of notes on it here in the dashboard as well. And I'll put my email in the chat as well. We always are wanting to help people understand the data that we have on our website and answer any questions people have. And we'll also take questions now, and I'll read through the chat in case anybody had any. But I believe we have some extra time. So yeah, Ann and I will be happy to take any questions you have, and I'll put the links in the chat, as I said.
Well, thank you, Scott. That's rather sobering data, and I think it'll really be interesting when the year 22 data is added in. I can't see anything but it continuing to grow up just from the anecdotal information that I hear. At this point in time, we're going to go to questions. So I didn't see any. Anne put some information about the chat website in there, and then her contact information. And Scott has put a link also. So I'm quite certain there will be some questions, and then we would like to at least talk about what are some possible next steps.
While we wait for questions, may I bring up a couple of important points I want to leave you with? And just jump in. You're not going to hurt my feelings. Unmute and jump in. We can talk. Scott, really excellent presentation. I'm always amazed at how the numbers really tell the story. And the story is very interesting and complicated because it helps if you think about substance use disorder and people using drugs as being on a continuum. And so you have people who are opioid naive, who maybe they had been offered a pill from a friend and they said, here, take this, you'll feel better. Or maybe they had wisdom teeth removed and they were given a prescription opioid. So there's lots of ways for folks to kind of on-ramp into being introduced to chemicals that may turn out to be problematic in terms of having a brain disorder, a chronic relapsing condition related to, these chemicals. As well as there are people along the continuum who have developed tolerance through using substances over time, where the body begins to adjust to the dosage of the medication, particularly with opioids, where you cannot abruptly cease an opioid because you will go into withdrawal, which is very painful, the worst flu you can imagine. Every pore is open, nausea, vomiting, diarrhea, sweating, goosebumps, just terrible, terrible flu symptoms that people who have the disease of opioid use disorder work at all costs to avoid those symptoms, and so are dependent and have to take more and more opioid to not get sick. So you really have a continuum of people, and youth are also on that continuum, where some of them are opioid naive and maybe are in the shallow end of that pool, whereas some of them maybe are going to inpatient treatment because they're specifically looking to use fentanyl because they have developed that tolerance. And I see we have a question from Shanna. Hi, Shanna.
Hey guys, really more than just a question. First of all, I really appreciate you guys coming today. Scott, you've been wonderful to work with. And so appreciate the dashboard for sure, and you guys explaining this firsthand. I wanted to just draw the group's attention to just one more kind of connection. So while some of these age groups are higher than necessarily our school age children are, we've got to think about this in a multitude of factors. One of them would be this is a risk factor for our students. And so if they're going home and parents are having opioid issues, then obviously we're going to be seeing the results of that in the school-based community. The other connection I wanted to draw, the line I wanted to draw, and nationally, we've been having this conversation, KSDE, you all know that we've been awarded the new grant for that SMHI work, and so we're excited about that. And part of that new grant, the SPIDIG grant, is expanding the work that we're doing into infant toddler services. And infant toddler mental health really focuses on that family unit. And so when you look at these age groups, these median age groups kind of dropping, and you're thinking about what's happening in their lives at this point, a lot of them are having babies. And so what is happening with those babies in those homes, and what protective factors can we insert, and how can we think kind of a big picture with this? So just thought I would throw that in there.
Thank you, Shannon.
Can I also add to that I did a substance use disorder treatment on the East Coast, which was ahead, unfortunately, of this curve for some time due to the ports and being able to get access to this. So they're a few years ahead of that horrible trend. And one of the other things that was really applicable to the schools was that while opiates and synthetic opioid overdose rates are often a little older than our kids' ages in schools, the age of onset for substance use is not. Matter of fact, most of the overdose death rates that happens with adults, when you track where their age of onset of SUD started, it is school aged and closer to that teenage-ish, late middle school, early high school age. So while these numbers are scary enough as they are, we're also seeing those kids in our environments long before they're at the overdose stage of addiction and with opiates. So that's the only other piece I'd add to that conversation too.
I'd like to throw it out to school-based folks and kind of just ask you to share what you're seeing in your school or your school district. And I know we have representatives from small school districts and medium-sized and larger school districts. So if anybody has some information they'd like to share about what you're seeing from a school-based standpoint.
I can share, and Janie can hop on as one of our school board members as well. But we are actually currently in the rollout of Narcan within our district due to the fentanyl use within our schools. I know last week we sent the critical incident response team to 3 schools due to students actively overdosing in our schools due to Narcan. And then we also had one hearing for a 14-year-old male who had 15 fentanyl pills on his person at school. So we are seeing fentanyl in our schools. We are seeing other drugs, which has been very common. We are in KCKPS, but we also have an active community activist group. Janie, hop in on this one too. Enough is enough is a huge thing for us to combat not just the community violence, but also the drug use and just risk factors in general. And so it really does focus on community violence in terms of gun safety as well as drug and alcohol substance use. So we are working to bring everyone together because we know that it's a community problem, not a in-school problem, that we have to partner truly with every single caregiver, regardless of if they're a parent or not. So we have been very active the past 2 years that I'm aware of in truly trying to be protective and proactive, but we are seeing a trend. So I was a little bit surprised that it was gray for us, but then I went, oh, it's been consistent since I've been in KCK 3 years.
And yeah, as Tracy shared at the end, she's in Kansas City, Kansas. So if others folks want to share, tell your district, but we'd like to hear from some others too. Thank you, Tracy.
Hi, this is Melanie Scott. I'm in Dodge City, Kansas, which is Ford County. Right now, we are not seeing, thankfully, any overdose with fentanyl. We have a huge vape problem in our schools. And so that is something that I know that we're working towards, but it's mostly THC. But no, we're not seeing as much of the fentanyl, thankfully, yet.
Yeah, have you added yet? Yeah.
But I think it was Ann that just mentioned the issue is naively just passing it on to something else. You don't know what you're taking, whether it's in the vape pen or whatever it might be. And so there's some issues with that.
Any other representatives from other districts? I see a few folks on that I might pick on. Misty, you're on, and John, you're on. I think Holly was on. I don't know if you guys are seeing anything you'd like to share or not.
I have to agree.
Oh, sorry. Go ahead, please.
Sorry. Okay. Sorry, John.
No.
I'm Misty. I'm from Southeast Kansas. I have to agree with Melanie. We're smaller district. We're seeing a lot of the vaping, middle school, high school range, really struggling with that, but not much of the fentanyl or anything at this point.
We're the same in Shawnee Mission. We have thankfully not seen any issues with fentanyl. We have had some graduates from our district who have been affected by it that we then learn about. But there is a group of representatives from a number of different organizations in the Johnson County area, healthcare providers, mental health providers, Department of Health and Environment, school districts from around our area who have come together to form sort of a coalition around opioids. And so we meet regularly. That's led by Jamie Katz with the Department of Health and Environment and Johnson County Mental Health. And so we get together regularly and discuss this issue and what preventative measures we can put in place to, try to do our best to curtail what we know is going to eventually be an issue for us and all districts. And I completely agree with Misty that while it hasn't been a problem, it will be. So we're sort of bracing ourselves for that as well and doing everything that we can to prepare now for what will, inevitably be an issue.
Let me kind of ask a little bit of a naive question. I think I know the answer because several of you have already mentioned a lot of vaping that you're seeing going on. I am guessing if the fentanyl isn't not already into the vape cartridges at some point in time, that's going to occur. So I don't know if there's somebody that knows that information or not that can share that.
I think they're using lots of things in those vape pens. Most inpatient substance use disorder treatment facilities will not allow folks to vape because you can put marijuana derivatives, you can put methamphetamine. There's lots of different routes of administration, and if there's one thing, people with the disease are exceedingly creative. So there's lots of routes. That's not a barrier.
That's kind of what I figured, but I wanted to hear somebody say that.
And this is Shirley Scott in Liberal.
Yes,
and
sir.
We're seeing an increasing number of vaping or increased amount of vaping use also. And as you say, they're very creative and it's getting worse. But right now, the major issue at the middle school and high school is vaping.
Okay, Carrie, you have a question about an increase in males. So Carrie, you want to ask your question?
Yeah, so this might be for John or Ann. So as and I can't remember which slide it was, but towards the end, you were showing the increases. And until 2017, the percentages of males and females was steady, and then from 2017 to 2019 males were creeping as a higher percentage, and then from 2020 to 2021 the percentage of males is skyrocketed in that 14 to 24 age group. And I just was wondering if anybody has any thoughts about that. And I should be more versed in our overall demographics of our percentage of our population of youth. What percentage are male and female in Kansas? I don't know that off the top of my head to start with. But
generally, and colleagues jump in on this, but generally men are overrepresented when we look at substance use disorder. There are preferences and trends among men and women and their use patterns. I guess one of the things I want to encourage you to think about is that some of this is about availability of a certain chemical, cost of a certain chemical. You know, when something floods a community and the price is way down, everyone's like, hey, this is what's at the supermarket. This is what we're going to buy. So some of it is individual preference. Some of it is availability in the community. And what we have seen is that fentanyl is flooding our communities. I don't know how, so to me, one of the issues that we see with individuals who use substances is something called polysubstance use disorder. So some people meet criteria, DSM-5 criteria for SUD for several chemicals simultaneously. Some people just kind of use what's available, but they don't necessarily meet criteria to be diagnosably, stimulant use disorder or opioid use disorder. So there's a lot of variability in use, and I think kind of what we need to work on as a community and as a team, schools and KDHE and KDADs and everyone, is the idea that there are risk and protective factors that we could be working on together to reduce the likelihood that anyone is going to use any chemical, alcohol, marijuana. To the brain, they're kind of all the same, right? You become addicted if this is your primary coping skill. So it's tempting. In the 80s, we talked about crack, and in the 90s, we talked about meth, and now we're talking about opioids. But I really do think it's important to remember that the dealers and the people who create these chemicals, because these opioids, fentanyl is entirely synthetic, it is man-made, it does not grow in a beautiful field of poppies. We have to get at root cause. And I think that's why we're here, because we know that because you serve our children and their families and educate them. We know you are the partners we need to do this work. Does that make sense?
Yeah. Well, and one of the things, and Shanna might be better to comment on this, that and this is anecdotally, but when we look at the trend data of identification of students with disabilities in the school age, it's trending that that there is a larger percentage of males being identified than females. So that just struck me. Shanna, I'm probably drawing wrong.
I cannot speak to causation on that. I'm sorry.
Right, exactly. And that's what I'm trying not to do either. So, yeah.
Okay, in the chat, Jean Clifford had put in there that she lives in the Garden City area. They've had several seizures of large amounts of fentanyl in that area. So Garden City sounds like they're experiencing some things. And then Kent suggested perhaps in a future meeting, we can ask Dr. Robin Kelso to present on what KSDE and our partners are doing with vaping. She's assumed the role from
Robin.
Dr. Thompson, who left. So I think we've got some options in the future.
Kathy?
Yes.
Yeah, this is Jane. Thanks,
Hey,
Scott.
Jane.
And this is so sadly very informative and interesting. And admittedly, I am opioid naive. I don't, I get that, doctors can prescribe, like you said, wisdom teeth or surgery or the oxycodones and things. And, that's one way. So a couple of questions. One is, does a doctor ever prescribe fentanyl for anything? And okay, and then that question about marijuana. I don't see it pulled out as a separate drug. Is it in this list anywhere? And then the highly debatable idea, I guess it's three questions, highly debatable idea of THC, marijuana, vaping leading to more serious drugs.
And looks like you were nodding your head. You might have some answers to that.
Scott can definitely handle the data question, but I would just say fentanyl is prescribed, is a legally prescribed substance, and it is prescribed for pain, sometimes in a patch form. So it's like transdermal, it goes through the skin. I've worked with patients who chewed on patches. So it is, people access it both through legal means but recently in the past few years, because you watch the news, illegally synthetic fentanyl, it's coming in through our borders. It's coming in through the mail, on boats, in cars. It's coming from other countries. So we believe this availability is driving this fourth wave of the opioid epidemic. It started out as a prescription epidemic, as you guys well know. So what we also know is that they're called analogs, where these very intelligent chemists tweak one molecule in a drug. And so it's no longer illegal. DEA can't stop you and say, you may not bring this in, but we can't test for it. So we're not able to necessarily find it on a toxicological screen. And we don't necessarily know how to treat you if you show up at the emergency department and you have taken some type of fentanyl analog it's really experimental. So this is exceedingly dangerous for young people who, as you know, are more inclined to experiment if they are not supervised adequately, all those issues that you know. So it's exceedingly dangerous right now for people at a high risk stage of life developmentally, where they may take risks or lack the frontal lobe and the executive decision making to say, this decision has consequences, I should not do this. Anecdotally, I will tell you, we're also very concerned about psychostimulants. The prescription of psychostimulants, which includes Adderall and Ritalin, is also increasing. I can tell you anecdotally, a friend of mine, her daughter's going to K-State, people walking up to her in Farrell Library saying, hey, I left my prescription in my room. Do you have an Adderall? They are passing what they think are prescription pills around. And these are some of our smartest kids, right? So they don't know that the supply is tainted with fentanyl. And that's where the one pill can kill messaging that you've seen from KDADs is fantastic.
Yeah.
Do you have something to add?
Yeah, I'll add on to that. Yeah, I was going to also mention that one pill can kill messaging, it's a lot of the stuff we're seeing coming up from the border and on boats and everything that Ann was talking about. The way they manufacture these is they'll make counterfeit pills, and this is a lot of what the national talk is about, is these counterfeit pills. So they look just like what you'd get from the pharmacy, only they're not. And so one of the big things that is being stressed, and if anybody has any further questions about this, I do have some stuff from the DEA about this, like documents and whatnot that they put out. But they look just like oxycodone, they look just like Adderall. But fentanyl, it takes such a small amount of it to overdose on. A lot of times what they'll talk about is just, it looks like a few grains of sand or a few grains of salt worth of fentanyl, and that can be lethal potentially based on your weight. So you could take, and then there's not quality control with the way they're being manufactured, like what is in a pharmacy. So you might take half a pill or might take something like that, and based on how well they've made them, half of the pill might have all the fentanyl in it and the other half might have none of it. So you split a pill with somebody, one of you might die, the other one might live. And so it's very risky. And that's part of the problem and part of what we think is driving this just drastic increase of deaths, because when you have that much fentanyl coming in with no quality control and not knowing where it is and where it isn't, it gets to be a problem. To talk about that marijuana question, you're not going to see it on this list here. Typically, you're not going to overdose and die due to marijuana. People will use it in conjunction with other substances. So we do have some data on that. It's just not on this dashboard at the moment. We've had people ask about that before, and I could pull numbers on like use, or at least like if somebody went to the hospital or if they died and they were also using marijuana with another substance, we can get numbers on that. So if there's interest, you could email me and we could talk further about that. But you're not going to see it specifically on these charts here.
Thank you, Scott. John, I'm going to ask you, John McKinney, to talk a little bit more about that group that you've got in that Johnson County area. I mean, if this group is interested in talking about, what do we do as far as some next steps and possibly partnering with KDHE, it might be interesting to hear, John, a little bit about what your group is doing and what you've kind of seen so far. So this is up in the Johnson County area.
Absolutely. Well, I know that Jamie in particular would welcome the opportunity to come and speak about what prompted the group to come together. She sort of organized it, reached out to all of our neighboring districts, school districts, and community organizations and health partnership organizations. And so we met 2 or 3 times just to kind of get together to look at data, share what we're seeing from our different vantage points. And just in this last meeting, we broke into subcommittees to start to identify what are our priorities as a group and what are we going to start to do to address those priorities. So we're kind of, I guess you could say, in the early stages of the process, but there's a lot of different people from a lot of different organizations at the table, all working toward kind of a common goal, and to eliminate deaths as a result of opioid use, and with a specific focus on young people. But I think that some of the practices that we put into place, will be applicable to anyone. So absolutely. Let me, I'll share her contact information. I'll put it in the chat, and then I can reach out to her and ask if she might have an opportunity to come visit with us.
I just have to say, Jamie Katz was an overdose data to action subrecipient, a grantee of ours for 2 or 3 years for overdose data to action. Fantastic work is being done in Johnson County. So yes, I urge you to, you don't need to start from scratch. There are plenty of communities that are already working on this, and there's lots that we could be doing. What I will tell you is that we're aware that some of the school districts in Kansas are stocking naloxone in their nurse's office in case a student or a visitor or someone else might overdose.
Yeah,
so
Olathe just did that. They went across the district.
We commend you. This is, This is a life-saving drug, and it is something that, dead people do not recover. And we would like people who are using substances to have the opportunity to cease using drugs and recover and be part of their family and their community again. So we believe in naloxone.
Okay, very good. And John, if you'd put her contact information in the chat, that'd be great.
Will do.
Do we have other suggestions or comments on this general topic? I kind of have some suggestions I'll go with here in a minute, unless somebody else would like to comment.
Yeah, this is John Calvert from
Yeah, John.
KSDE. I just had a question. When we're forming these groups to help stomp out vaping and the fentanyl and the opioids, are we involving students in that conversation as well? So much of what is going on, they're using Snapchat and they're using social media to buy, sell, trade drugs. And so much of that is over my head. And I'll be honest, that's my job, is to try and get in there and know these trends. And by the time I feel like I got a decent handle on things, they've come out with the best way to avoid adult detection. So I really, really feel like if we're going to be comprehensive, we're going to put together a really good group, we've got to target and have some of our leaders who are kiddos in on these groups who can help with that conversation, because they know what's best and they know what will work and what won't work. I like to joke that vaping is not a new issue. I am going to come out with a new song, though, that's called Vaping in the Boys' Room. I see not all of you are as old as I am and probably remember smoking in the boys' room. But it's a new form to an old issue. And so, again, I just implore everybody who's putting together groups, get some of those junior, senior, and high school leaders. Get your leaders in your buildings on those kiddos and get them involved as well, because they have tons of knowledge, and I know that they're willing to help out. And I think it'll be more effective when we build up from the ground up. I think it's just so important that if you buy in, you can sell out. But if you have that ownership, you'll succeed and have that great foundation.
John, I'm going to lovingly and gently push back on the thought of our known leaders, because oftentimes they don't have the ins to the students that are doing a lot of the risk that we see. So I'm going to also say, in addition to our known leaders who we recognize and celebrate in many ways, that we also include those who have infractions around these things, who have affiliations that our known leaders don't have, because they're the ones that have the actual inroads to where things are coming from, how people are getting it, and what would actually make students stop using it or not use it to begin with. So in KCK, we are actively looking for safe ways to engage those students, because we don't want students with our gang affiliations to be harmed or have something occur. So our Enough is Enough committee is putting together, they're in the process of putting together a student advisory council, but it has to be in a safe way, because our known leaders are celebrated. They are recognized regularly, but our students that are the ones that would be the most insightful and helpful in a lot of ways are the ones that we need on board. So we're doing that. And then they also currently do have, in all the initiatives for Enough is Enough, we do have student input and all of that as well from our known leaders who are there and open. But I wholeheartedly agree with you, John. I just gently push back on some of it.
Kathy, this is Gary from KDH.
Hi, Gary.
From K-Heads. Where am I from? Sorry. I'd like to just also put out there, we have youth leadership in Kansas, the Y-Link groups, which has been expanding quite quickly recently. We're up to 36, 37 groups across the state right now, and that's been expanding pretty rapidly. Those groups, for folks that don't know, are made up of kids that aren't necessarily just the leaders. They're of kids who come in from any direction. We have a real mix of kids in the different areas that are either the leaders in the school or the kids who were struggling in the school, wherever. And those groups all define what particular thing they want to work on. What is their goal? What do they want to work on? It has to be related to something to do with SUD or behavioral health or stigma reduction to be able to become under the Y-Link umbrella. But we do have several groups that are working towards, this kind of issue. And as I'm listening to this, I'm thinking, how do I get this information to them? It's really, we have to think about how we bring this information to youth, and how do we, help them use that information so that it's something that's palatable to them. When you educate youth, when you teach youth, when you do a conference for youth, it has to be quite different, as you guys all know, than it would be for us. But boy, once we get them into working on it, they don't stop. They just keep going. So I think that that's another way that we can do it. Tracy's right. We can't just go with the leaders, but how do we get all youth involved? Y-Link used to be the groups that were just the kids who didn't have anywhere to go on Friday nights. But we've opened it up, and now we have a good mix of those kids and the kids who are involved. People said they couldn't mix. They mix very well.
So Gary, this group is called Y-Link, L-I-N-K?
Y-Link, Youth Leaders in Kansas.
Okay.
And it is a program that my team runs. 4 or 5 years ago, we had 5 groups. We're now up to 36. We've gotten 9 or 10 new ones just in the last 6 months. But it is something that we would be willing to talk to any school, any community organization, any church, any whoever that has a group out there. They not only work on these issues, but we have a youth advisory group that works with the Governor's Behavioral Health Planning Service Council, and advises to and answers questions to any of the subcommittees. They also play a big part in Advocacy Day, and it can be an already organized group, can become a Y-Link member. Does not have to be. There are groups that need some funding. We have minimal funding we can do for them. But we also have groups that just want to have the connection to connect with the other youth groups and to do and work in the advocacy piece of this. So we can have funded and unfunded groups. You don't have to need the funding to join our network of youth groups. So if anybody wants information about that, they can certainly contact me, and I'll get you in contact with my staff that work on that.
It sounds like we've got a couple student groups going already. One is this Y-Link, and then I know Melanie in the chat had mentioned Resist, which is a youth-led vaping prevention program. So we've got a couple student groups that are going and working on some form of this. So it might be interesting to tap into kind of what they're doing, and because I would guess they could probably help us some.
Well, Kathy, one of the things we're trying to do with Y-Link is to bring some of these groups together, because a lot of the youth groups find themselves as a small group, and they're trying to do something and they don't feel like they make the impact they want. So if we bring them together as a statewide connected group, the STAND groups from MIR is one they're all Y-Link groups now, but they still are STAND. But it is one that's made some pretty impressive inroads in their community. But they also have joined into the Y-Link groups to connect with other people across the state. It gives the kids a sense of a bigger statewide voice.
Okay, well, I'm kind of looking at the agenda time, and I guess I'm going to kind of summarize a little bit with a couple of possible suggestions. I think we've got some folks who could come and present to us some additional information. And one is, as Kent mentioned, Dr. Robin Kelso, as far as what KSDE is doing with vaping. So I think that could be helpful. And then also, there was another, looking through the chats. Okay, well, I'll find it, but there's another group that I think could help us too. And then just some information about these student groups.
Kathy, I think Jamie Katz, John
Yes.
McKinney's group.
Yeah. Seems like there might have been one more, but I'll look through the chats and see what I can find when we're on break. So I would suggest that we do some follow-up on this. Sounds like to me we've got some organizations doing a lot of things already. It might just need to be some coordination and additional getting out of information to folks. I don't think this problem is going to go away on its own. I think that's probably pretty obvious to everybody. We've got some issues we've got in our communities. It isn't certainly just our schools, but if it's in our communities, it impacts our schools. So I would suggest we do some follow-up and we'll get the leadership team together and kind of see what would be some next steps. Again, if you have some additional ideas or suggestions, either put them in the chat or reach out in an email to us. That would be helpful also. So anything else for the good of the order? Yes.
This is Jean Clifford.
Yeah, Jean.
I just wanted to say that having a recommendation from the group on naloxone might help districts be able to support that in their district. I think there are some controversy about it, but having a recommendation from this group to do so might be helpful. That's all.
Okay, thank you, Jean. Did you, Shauna, did you have something else?
Yeah, I just wanted to say, so Scott has this dashboard that's amazing and shares a lot of actual data and information that I think is important for us all to be able to have at our fingertips. KDHE also has their suicide dashboard that is now up and running. I'm very excited about it as well. I know I get excited about the bad stuff, but anyway, and so hopefully at a future meeting we can also share that new dashboard and how that's operating so that you all can kind of see how, as state agencies, we have access to information.
Okay, and the suicide dashboard is through which group?
KDHE as well.
All right, okay. Okay, all right. Well, we'll come up with some recommendations to going forward as far as what to present to this group. A lot of good discussion today. So Scott and Ann, thank you very much for bringing this. This dashboard is, I'm kind of, I guess, excited, but also a little bit scared to see what the 22 data is going to show us. I anticipate we're going to continue to see that upward trend, which is very unfortunate, but very real. So I think we have some work to continue to do. And I think we've got some ideas of kind of how to move forward. And we already have some active youth groups. So I think that's very helpful because our kids are who can help us. There isn't any doubt in my mind about that at all. So thanks everybody. And we'll have some more information on this. Hopefully at the next meeting, we'll kind of continue to work on this. Okay. Our next agenda item is a report from Kent and Shanna on the Castle conference report. I know you guys have a couple of pieces of information to share. So I'm not sure exactly who I turn it over to first, but we'll move on to our next agenda item. Thank you.
Hey, Kent, can I start real fast and then
You
let
betcha.
you fill? And then we can end with me again. But I just wanted to start with a quick activity that they actually had us do at the Castle conference. So Castle is the Collaborative for Academic, Social, and Emotional Learning. And Kansas is one of the teams that is on the national meeting of state teams and leaders. And so Kansas has been very active in it. I was super excited to get to go with Kent this year and experience it. It was one of the first times that within this position, I've been in an environment where I'm like, oh my gosh, like-minded people, these are my people, this is where I belong. So it felt really good. But one of the activities that they did during our very first night there was they had us have a conversation at our tables that I think was very valuable. It kind of got emotional for people, but I think it's important to kind of pose this question. And I know that we're not in person to be able to talk and chat about it, but I am hoping maybe you can take just a couple of seconds to think about what your answer is and maybe place something in the chat just to kind of keep our focus on what we're here for. So today, as you sit here and you're in the School Mental Health Advisory Council meeting, you are an advocate for children. When you think of that work, what child in your life, at home, at work, in the community, what child, who specifically do you picture in your mind when you think of the work you're doing now and how you want it to change their future? So if you just want to put some things in the chat, we'll all ponder on that, and then Kent can give you his debrief.
And if anybody wants to share just to the group, just share, unmute, and you can share to the group. Otherwise, put things in the chat.
I'll go ahead and kick us off here in person, if that's all right. When I think about the things that we do and that I do specifically, I always think of my own kids. I have an 8-year-old and 11-year-old. I want them to be safe. I want them to grow up in a world that's better than the world that I grew up in. And I think that's everybody's goal, is to leave this place a little better than when we got here. Moreover, my wife's an elementary school principal, so when we talk about school stuff, I put that hat on too. I want my spouse to be safe and enjoy what she's doing when she's at work. And so I think that helps me in this position when I keep that at kind of the forefront, because I'm able to talk and wear a lot of different hats, which is good because I don't have a whole lot of hair up here. So it's good when I can wear the hats. But definitely when we start talking about mental health and we talk about school safety, those three people are the ones that I keep at the forefront of my brain.
I can chime in.
Shanna, this is Jane, and it is a fresh issue to me because even just this last weekend, we kind of had a family reunion celebrating the 80th birthday. And so we have large families. And so I knew that a nephew had been struggling with drug abuse on the West Coast in the state of California. So I know it's no different anywhere, but he went into treatment. I talked with his father, and he had friends that died of fentanyl, and he was addicted to fentanyl. And so he went into the program. He's on the drug to, it wasn't Narcan, it began with an S, something to help him get off the drugs. And he's afraid to get off that drug because he's afraid he'll go back. And so this is so fresh to me because I just had the discussion with, you know what? It's not a nephew. It's a nephew's son. It's a nephew's son. So it's more distant, but I know the nephew, closer. So anyway, it was his son, started in California, now live in Texas. So I was just hearing and learning about it. So my thoughts and prayers are with this nephew's son, Noah.
Thank you for sharing that, Jane. I can give my own example. I have a great niece that is 3 months old. Her parents are teen parents. Neither one have parents of their own. They have they're all deceased from drug use and associated violence with that. And so this little baby is adorable and 3 months old and has parents who have no idea what they are doing, struggle every day to keep on the right track, and need their community to really wrap around them right now for her to be successful. And even at 3 months old, she has a high ACE score. And so we've got to build those resiliency things. And so I'm really hoping that we can get community systems in place to be able to catch those kinds of families as well. Does anybody else want to share who they think of?
Shauna, I'm thinking, my kids are older. I do have 2 grandkids, but I hear my daughter being fearful of sending them to public school. as they get to that age because of things like this. And I feel like, boy, they need to be in public school, and it's a real struggle. But then I also think about, I'm involved in complex case staffings with kids that are already in the system on a daily basis. And the stories I hear from the families we deal with are just incredible. I mean, it's gone on. It's the same thing that I've heard. And, in the 4+ decades I've been doing this work, and the numbers of decades you guys have been doing this work, it's the same thing. We have to figure out, how can we support these families? How do we treat children, and make sure that when we're treating children and supporting children, whether it's treating or supporting, that we're also looking at the entire family system. We have to look at the whole picture. We can't just isolate this child. And so, I mean, it's I was on a meeting yesterday with a person who had a child who's got all of these issues going on. And, how do we also get not just educators, but treaters and everybody to really be taking a look at some of this bigger picture stuff? How do we support them in understanding that? But it's, hopefully we get to a point where we don't have, we can see that happens without, I don't know. Some of the questions I get is like, how come we don't have this information out there? How come people don't know these things? But we just keep putting it out.
Thank you, Gary. Sheree, I saw you had your hand up.
Yeah. So I'll jump in and say that, I've got a cousin who is, now in his late 20s, but, when I was in grad school working on my social work degree, he was in high school. It was the first time I became actively involved in IEP meetings, trying to be an advocate for him. He grew up in foster care since the age of 5. Was pretty much, I've got his school records, was in every alternative school I think Kansas has. So he's probably given some of you a runaround at one point or time. But yeah, I said earlier in chat, it's been a second since I've reviewed the current stats on the correlation between ACEs, trauma and substance abuse. But I remember, when everyone really first started talking about ACEs and trauma, that really helped us to gain a lot of traction for moving forward, with work in the area of mental health. It wasn't long after that a grant came along, and it was, focused on substance abuse. And I found it interesting how everybody then kind of transitioned to that. When I think of my cousin, for example, substance abuse is more of the symptom, not the cause. And so I do think going back and talking about family engagement and trauma and ACEs and the supports that are there is essential. There's the border issues and everything like that. I heard John earlier talking about, some of this is just kind of, the drugs have been around forever. And, I think kids are often going to be able to find, the drug of choice, whether it's a cigarette or, a Red Bull, who knows. But I think the focus on healthy coping skills, I think understanding brain development, I think understanding other ways to regulate the body, besides the drugs. But so yeah, I think of my cousin, family systems, the whole serve and return, and just want to be sure that as we focus on drugs, we're also focusing on prevention, which is, I think, yes, controlling it coming in, but also trauma. So thank you.
Thank you, Sheree. Jean?
Yes, I just wanted to say this is really all integrated in my mind. From the suicide statistics that we just learned about, to drug abuse, mental health, and all of these have to be looked at as a whole, with the just different aspects of it. And it calls to mind to me that maybe you've heard of the broken windows style of policing, meaning getting at things immediately rather than sort of letting them go. And I think that's probably one of the approaches that we might take a look at, looking at the first initial symptoms of things that could spiral into leading to much more serious situations. So I thank you for all of your work, but I do think this is a huge problem, and it will take everybody from looking at all aspects of it to try to find solutions and improve it.
Thank you. Kathy, is there any way we could go ahead and take just a 5-minute break and let everybody kind of gather their thoughts before we move on to the debrief from Castle?
Sure.
And I can share a picture while we're on break, if that's okay.
You bet. Absolutely.
All right. Well, then don't start till I get back.
Okay, so we're going to take just 5 minutes real quick, and Shannon's going to put some picture on. Well, that's about the cutest little person in the world right there. I don't know if everybody's back or not. We'll wait for just a little bit.
I mean, I might be a little biased, but I think she's the cutest baby ever.
Well, why don't you just introduce us to this person?
This is Scarlet Moon, my great niece that I was talking about.
Well, she is very cute.
She is. She has just the one dimple.
Just the one?
Yep.
Well,
Happy
she sure is. How old is she?
3 months old.
3 months old. Boy,
Mhm.
she's cute.
Thank you.
Okay, well, welcome back, group. It's like we've got that introduction to a new little member of Shauna's family, so pretty exciting. Okay, Kent, I think we're going to turn it over to you to give us a summary from Castle.
I don't see him on here yet. So I will screen share a picture from the event that we were at. This is Tim Shriver. He is one of the co-founders of Castle CEOs, and he is also the co-founder of Special Olympics, which my son's very active in. So I was totally geeking out. Other people get excited about movie stars or, singers and stuff. And I was like, oh my God, it's Tim Shriver. So he was incredibly motivational. If you ever have a chance to get online and look at any of his work, he has so much to say about inclusion and the benefits of it. And he's a huge advocate for family engagement and community engagement in the area of mental health. So there's Kent, perfect timing.
Thank you. First of all, I got to tell you, Shanna, and Bert will verify this, Shanna is the best traveling partner a person could ever want, other than one's spouse, I suppose. And she'll have a story after I get done. Unfortunately, the work that I did focused on, first, Castle is all about social emotional learning. And we have been a part of 2 different initiatives with Castle for many years. Kathy, you'll remember when we first adopted the SECD standards, we were asked to be part of their collaborative states initiative. And that was the first day meetings was around states that have adopted or are in the process of adopting social emotional learning standards. Unfortunately, SEL has become a political football. And Jean can offer evidence to this. The far right is using SEL as a political weapon in their campaigning. And a lot of states are struggling with progressing social emotional learning forward. So they asked us what Kansas is doing since we were one of the first states. Well, one of the things that we saw was that employability skills are very much a part of social emotional learning. Kids are not going to graduate if they don't have a good social emotional learning background. Success at post-secondary isn't going to happen unless they have SEL skills. So what we're telling them is call it what it is other than social emotional learning. The legislature is going to probably address social emotional learning. In Oklahoma and Texas, they introduced bills to defund social emotional learning. I wouldn't be surprised if that occurred this year, especially through the K-12 House Budget Committee. All right, so call SEL what it really is. There are 3 statutes that the legislature passed that are social emotional learning. The first being bullying prevention. The second being the FLAT Act, suicidal ideation, and the third being mandated reporting. Those are all social emotional learning pieces of legislation. So we need to remind those that are critical of social emotional learning that it's been in statute for quite a while. Other examples, and Shanna probably has already mentioned this, but there were great examples at the conference about service learning and how schools have worked with community partners to develop social emotional learning skills through service learning and community service. So we tried to help out. It was a great conference, but it started off with an interesting taxi ride. Shanna, you want to tell us about that?
I sure will. Let me show something else just real fast first, just because I have it pulled up and ready. So that same introductory night, if you've never seen the Chicago Children's Choir, I can't remember what the current name of it is. I know that that's an outdated name, but they were phenomenal. So I just wanted to share this with you real fast. Could you all hear it? Oh, you couldn't hear it?
No.
Oh, darn it.
That's too bad because it was great.
Let me see if I can. Well, darn it. Yeah, I'll try and figure it out later. Let me pull up another picture though for you all. Favorite picture of the entire time. Mr. Can't read. So yeah, we got there, had an incredible taxi ride where the taxi driver was completely insane, was going, I can't diagnose him as insane, but I would logically say he's probably insane. He was driving through neighborhoods, he was speeding, he at one point stopped on an overpass and backed up. He was cutting in front of other vehicles, and I was not convinced that we were going to get to our hotel alive.
It was like a trailer from the movie Jackass. I kid you not.
Mm-hmm. Kent's face was priceless the entire time. And I said, I'm not riding in a cab again in Chicago. I usually take the L. He said, there is no way you're going to get me on that L. And I did. By God, Kent rode the L. And I think he even liked it. He had a smile on his face. He was holding his luggage real tight, but I think he had a good time.
It was a cultural experience that I'll never forget.
I have to tell you, Shanna, my worst taxi ride ever was also in Chicago.
Oh my goodness.
Man, you just can't take the taxis in Chicago. I take my luck on the L any day. I'll follow up with a little bit of what Kent had talked about. I was really fascinated by this conference because they did it in a couple of different ways. Our first day there was that collaboration and really talking to the other states about what they're doing. And I got a wealth of knowledge about what some other states are doing. For example, Nevada has a third-party collection of climate data. There are states that have climate reports required through legislation, school climate reports, which I found really, really interesting. Not something we do here. There was another day that we had an unconference, and so there were topics, and then people were conversing about those and what they're doing in different places and how it's all working. And first of all, through that, I identified like several other people that definitely should have been at this conference with us. But working with higher ed and teacher prep was a big topic that was on there. Part of a piece I took out of this that I know we got to look at is our work with our SPDIG grant, with our state personnel development grant. And, we're going with the direction right now of getting trained up on all of the neuroscience, getting the school family liaisons through the MHIT project, trained on that with Shree's team. But school nurses is another population. You think, what's the thing that comes into school nursing offices the most? I have a tummy ache. Well, what's normally causing a tummy ache? A lot of times it's anxiety or stress or something like that. And so also really involving our nursing staff more than we have up to this point. So that's another takeaway I had from this. The other kind of, I think, question I continued to push back and have on was how can we communicate the importance of mental health in schools to the people who don't want to hear it? And how can we correct the misconceptions and the untruths that have been shared and that people don't know not to know? And so they talked about this concept of pre-bunking. So we all know what debunking is, proving something wrong. They talked about pre-bunking. And so getting ahead of the issue, and they kept saying early and often. early and often, sending out your messaging early and often, choosing your words to inoculate people against lies and myths and prime the audience to reject false claims. I thought that it really stuck with me. I wrote that whole thing down because I really think that that's important as we continue to be individual advocates in our worlds. That idea of pre-bunking and helping other people be knowledgeable about topics, which is why it's so important for us to have information like we got this morning, right, on the overdose dashboard, because even though that might not be everyone on this call's direct work, it impacts our entire community and society. And so being knowledgeable what is and isn't factual information is really important. So that is a lot of what I got from the conference, and that I want to work for Castle because they're just amazing and great people.
The last thing that I would say is a forewarning, and it's early yet because the legislative session won't start until January. We were fortunate, and this is what I told the other states in Chicago, we were fortunate. The only real threat to social emotional learning that came out of the legislature was House Bill 2567, Section 27, about the screeners. And it was a problem and continues to be a problem, and it impacts the work of this group considerably. I'm afraid that was the start. So as the legislative session unfolds, we will brief you guys on the progress or the digression, whichever, whatever comes out of committee work. We'll let you know how that goes.
Anything else from the conference you'd like to share, either one of you?
We just need to take more people with us next year.
Yeah, absolutely.
It sounds like
maybe
fabulous.
I would like to take a legislature member, please, legislative member.
Yeah, I can see why. I like the pre-bunking concept. I think that's a good one. And I think one that could be used successfully. And to make folks understand there are certain things we already do that fall in the school mental health realm that are legislatively required. So some good things.
And to take off on that, and part of it is that legislators just don't know. They don't understand what all that falls under the social emotional umbrella. They are very proud across the street about the initiatives that they have instituted with mental health. But then they slam social emotional learning, and yet mental health is very much a part of social emotional learning. So it is going to be, I think, incumbent upon us to try to educate them.
Yeah, very good. Okay.
Can I just say something briefly, Kathy?
Yes, Jean.
I just think it would be really helpful if you could go, or someone could go back and look at all of the legislative initiatives that fall from our perspective into the social emotional area, and just provide a list of them to them and say, well, thank you for this because this is social emotional to us. And this is a huge hurdle to get past with them, because those words are really trigger words for across the street there.
Well, and I might add, I was going to say this later, but I might add, I think sometimes our best advocating we can do is with our own local legislators. If they understand the work that we're doing, and maybe as a council or maybe the department can put together some of those lists of things that are legislative initiatives. I mean, you know, if you look at the legislative, the pilot that was started, and Diane, you've worked with it for several years, about providing that mental health support, that came from the legislature, you know, and that was an initiative that they started. Well, if that isn't school mental health, I don't know what is. So, but the individual legislative advocacy, you talking to folks you know or that are in your community that you vote for or don't vote for, and sharing with them those stories, I think can be about as powerful as far as getting individual votes, either voting for something or not voting for something, can be about as strong advocacy as some of us can do individually. There's some folks in this group that are more politically astute than I am, and they may or may not want to comment on what I've said, but I think last year there were some things that you guys had colleagues within your group, you got information out and you had colleagues within your group talk and send emails and make phone calls to legislators about certain topics. So I think there could be some direct advocacy that you and some of the folks that you know do, and that doesn't necessarily just come from this group. And I was going to share that when we talked in a little bit, but I may come back to that. So anything else for the good of the order at this moment of that? Okay, I'm going to move. Well, actually, do we need another break? I saw where a break was listed after this report. We just took a little break. How about if you need a break, you get up and take a little break? Okay, we've got a climate report. I don't know if it's Christina Mann on, but she's listed next. Kayla,
She is not currently on. I sent her the Zoom link so she had it. She was planning on being on closer to 11.
Oh, closer to 11. Is it possible that Bert and Carrie can start on the behavioral concerns piece?
Yes, we can, Kathy, for sure. Bert, do you want to go first, or do you want me to kick it off? Is he on here?
I hear Bert's voice in his office.
Okay, so
he may be talking to someone.
Okay,
so
sounds
Shannon,
good. Yes, let me pull up.
So Shannon, I'll just do a little introductory piece while you
Yes, please
pull that up. So this agenda topic is, as you know, there's been lots of reports and experiences of increases in behaviors in classrooms, especially at the early elementary levels, that have come about. And what we're doing now is looking at it in a more systematic way than we were, or trying to look at it, and then recognizing, I guess I say, since I've been around here for 3 decades, that there are just so many different factors that are impacting what's going on in the classrooms, that we are wanting to kind of step back and look at how we can approach this and provide and get support and information out there in districts and schools that and help them realize that they're not alone in figuring this out, but at the same time, relying upon an outside entity to come in and fix things isn't sustainable. So our leadership from our Autism Tertiary Behavior Supports project, many of you know her, Lee Stickle, and one of our co-directors from the Kansas Multi-Tier System of Supports and Alignment, Linda Wilkerson, came and met with Bert and I, and we're intervening on this at a statewide level.
Carrie, you're cutting in and out just a little bit. There was a few words I think some of us didn't hear there. Yeah, maybe it's me.
Carrie, we can't hear you at all now.
Okay.
There you are.
And doing so that increases the capacity of district. So when Bert comes back on, I'll let him join in, but Shanna, do you want to go ahead and?
Yeah, I can go ahead and do a little bit. So when this was brought to my attention, I mean, obviously we've been hearing, behaviors in classrooms. We can't teach. There's so many behaviors. So I really wanted to pull our data and look at our numbers of discipline, because that's kind of our closest thing we have to quote unquote behaviors in classrooms right now, as far as the measurement. So I pulled pre and post COVID, because if anybody has been around children lately that are kindergarten age, you will see that they are the COVID generation kids. I used this example yesterday in a meeting, but I'm going to use it again because I just think it's a perfect example. I was at an event the other night, and there was a little girl that wanted a drink of water, and I directed her to the water fountain, and I see her go over there and she starts lapping it up like a cat. I mean, just licking it up. And I'm like, oh, that's not how we drink from a water fountain. She literally had no idea how to drink from a water fountain. So I had to go over and show her how to suck water out of a water fountain and not lap it up off the bottom of it. So we've got this whole kind of, generation of COVID kids, right? So I thought, well, let's look at what the data shows from before COVID and what we were seeing as far as discipline in schools, and then post-COVID. So maybe it will let me advance. I don't know why I'm struggling with this significantly. Struggling.
Shanna, mine's telling me my internet connection is unstable, so I hope yours is better.
I hope it is too. I'm gonna share a different screen, I guess.
It usually means it's going to drop here in a second within the build. Yeah.
Okay, well, I know this is not the view I want you all to have, but can you at least see the chart?
Yes.
On there. Okay, so this is enrollment that I want you to know, because I think the enrollment increase is important. So between the year 2017-18 school year, so pre-COVID, and then the 21-22 school year, so our most recent post-COVID, right, data, the state gained 26,553 enrolled students. Okay, so we had a significant gain of student population during that time. That being said, this is showing, I wish I could get it bigger, the discipline incidents, again, the 2017-18 continuum of that. So between that time, we have right about the same amount of students that received in-school suspension. Now, these are not incidents, these are students. The incidents actually followed the exact same trend. It actually went down a little bit from pre-COVID to post-COVID, which I don't think is what any of us thought would happen. So then when we look at the count of students provided or given OSS, so they received out of school suspension, again, the count went down just a little bit. Even though the enrollment numbers went up, the count went down. Same thing happened with the number of students expelled. Same thing happened with the number of students removed by school personnel to another setting. And then the same thing, well, then you could see the total of students with total disciplinary removals. And that was a little higher in the 17-18. So it went down in all areas of discipline. Fewer students were disciplined between pre-COVID and post-COVID. So then that gets us to that question that we were asking earlier, and that Bert and Carrie and the TASN team really brought up, is why are we getting so many more anecdotal reports of behavior concerns in schools, and what are we doing about it? I'm going to go through just a few things that we are trying to do and work with other agencies on. We can pull up. The first item, I'm very excited about this. Sorry, I have about 50 things open on my desktop. Do you all see this flyer? Yes, okay. This is a flyer that I cannot seem to get to. Man, technology is not my friend today, guys. Here we go. All right, so there have been many attempts made at providing youth mental health first aid across the state of Kansas to a variety of populations, including educators. Our educators, we hear all the time say, we're not trained in this. We're not trained as social workers. We're not trained as counselors. We're not trained in behaviors. We're not trained for this. Youth mental health first aid is a really good introductory, not training, but knowledge base. So we are partnering, KSDE is partnering with DECA and KDHE to provide a modified youth mental health first aid course. It's going to be a cohort course that starts in the spring. It's going to be 5 weeks long. So it will be in the evenings. The cohort, the class that's selected for it will be chosen by application process. And we are targeting the audiences of teachers, school staff, coaches, counselors, youth group leaders, parents, any adults that work with youth but don't have a mental health background, it's not appropriate for those that already have a foundation of knowledge of mental health. So the class will be in a format more like you would find in a university setting, where they're going to get the first week of it will be instructional time, 2 hours of instructional time. And then the following week, they'll come back and have breakouts and have case studies and have their own situations examples to share and problem solve on and think through from a mental health perspective. And then the following week, again, it will be content. And then again, it will be the week for collaboration, and then it will end with content again. We are excited to see what our response will be for this. So we're going to, it's not out yet. I'm hoping to put it in the newsletter as soon as possible, but I wanted to show it to this team first because we are excited about it, and there is funding to do more than one cohort if we have good success at it. But I think that this is an opportunity that we didn't want to just limit to those that typically work in the mental health area. We want to target those people in schools that do not work in the mental health arena, because they're working with these kids with behaviors as well.
Is this going to be an online class or in person?
It will be via Zoom.
Okay,
yep.
So folks from throughout the state can participate.
Mm-hmm. Yep, we have 3 instructors that'll be working on it. It should be really good. A lot of work that's gone into it.
You know, Sean, I think this is Gary from KDADS, and you know my feelings about mental health first aid. And
for sure.
I think this is great. We struggled within the disaster relief grant at times to get youth mental health first aid out there, because we had difficulty getting schools, because you have to have that school component to buy into it. But I did want to just say that one of the things we were able to do within the disaster relief grant with Emporia State University, and I believe it's K-State, but Emporia State, actually, we were able to get, I think, 6 trainers on staff with them that are actually working to make it part of the curriculum. And most of the graduating educators are leaving with basic mental health first aid at this point. Something I'd love to see across the board, so that we have our teachers and anybody working in a human service field leaving with that basic information. Some people are real into mental health first aid. Some people struggle with it a little bit, but my point of view was, boy, we had people leaving with nothing.
Right.
And
exactly.
I am a mental health first aid instructor myself. So I think it would be very important that, whatever you guys can do with this is great. And if we can also get it throughout the education system, so that our teachers and people working in human services are leaving with that, certainly can help a teacher decide the difference between what's defiance and what's a possible behavioral health issue.
Yeah, exactly, Gary. And that piece we said before about working with higher ed on some of these mental health topics. I mean, it's just vitally important that people can distinguish between what is a mental health issue and what's normal, typical behavior. That's something that every teacher struggles with. And even as a parent of, I have children with special needs, and sometimes I'm going, is this typical teenage behavior? Is this not? And the same thing applies with mental health. The other thing I did want to mention, well, first of all, I want to give a shout out to Kelsey Torres. Kelsey, do you want to pop on and say hi and give your thoughts on this course real fast?
Yeah, hi everyone. I'm excited. I think like it's a great blend between not only like the evidence-based training, but also like the opportunity to network with like peers across the state. I think like for this particular audience, I think it's a great opportunity to like adapt what we know is a great training really for like their best learning style. So we're going to build out some like pre and post like evaluation of this format, and hopefully we find success with it. Like we're really optimistic about it. So hopefully like the feedback that we get through this first initial cohort like reflects that, and then we'll be able to continue offering this moving forward. But we are excited to partner with DECA and KSDE for this.
Yes. The other piece I wanted to mention, just that I'm super pushing and I think everyone should know about, Hannigan and Hannigan. Oh, I don't know if you can see the book. It's called Don't Suspend Me, an Alternative Discipline Toolkit. Sometimes I think that it's just, you're at a loss. You're in a classroom, you're responsible for 25 students, one's acting up, what's your go-to, out in the hall or go down to the office or whatever. This book, although it seems very small and simple, has some of the best actual tools that I think if teachers and educators knew about and had in their hands, they would use them in a heartbeat. There are things, and if you have a kindergartner who steals a piece of candy out of your desk, instead of sending them to the office, instead of doing other things, there's ways of repairing the situation, restorative justice techniques, things like that in this book. Hannigan and Hannigan does work with our TASN team. And so I'm really hoping that we can get them as some keynote presenters at some of the conferences this year and really push their work, because I know every teacher that has ever worked with me, that I've ever had the pleasure of working with, would love to have some of these tools just right in their tool belt to be able to pull out and use instead of typical disciplinary measures. That would also then help that school climate and culture that we're so desperately trying to measure. Bert, you want to talk more about behaviors?
Well, the only thing I wanted to suggest or share is that we've had several specialists that have contacted us about the number that they're getting requested to support significant behaviors at the district or building level. And so what they were suggesting is we're looking at an upside down tiered system where all of a sudden our tier 1 becomes our tier 3 for many classrooms where we have significant behavior issues. So one of the things that I wanted to ask of this group is, are you seeing an uptick in the number of referrals you're receiving due to significant behaviors of students in the schools? And if you're not, you might be. We're trying to look at what we can do, and I think that Hannigan, please don't suspend me, because oftentimes what happens is a student that has any type of trauma or any type of a gap in their social or emotional skills will get referred to the office. And because they oftentimes arrive at the office with an attitude, the first response of the administrator is, "You're out of here." And so then you end up with the suspensions adding up quickly, and that student's being denied an education when in actuality that behavior could be a symptom of an underlying mental health need. And so having mental health response within the school systems is so critical and important, but also we have a lot of new teachers. We have a lot of substitute teachers. We have a lot of paras that are going through training programs to be teachers. All of this adds up to not having the most highly skilled staff in classrooms. So I would be hopeful that if you have any of the districts reach out to any of you to provide support for mental health, then this would be a great opportunity to provide those wraparound supports that we were trained in years ago when I worked with Fort County Mental Health to write one of the first grants. And we actually sat down as teams and we worked on how to best approach this through the home, through the school, through the community on a one-on-one basis per student. And it seems like everybody's in such a rush these days to just get something done and move on, that we're really not providing that in-depth of support for our students that have the biggest needs. And that's what I put this on the agenda to share with you, is we need to do a better job of wrapping our supports around these students versus just putting them out of school where they're missing out on critical instruction and they are potential dropouts. And that's what we want to avoid.
A couple other resources that have been really useful in KCK. We partner with KIP Core, and they provide really great training that's specific to schools on restorative practices and how to integrate that within the MTSS system. And then if your district has used TASN or any of the KSDE resources where PBIS is the framework that they typically use for social emotional behavioral support, they can help to customize that to be more responsive to restorative practices versus behavioralist practices. And then the Center for Conflict Resolution is based out of the metro area, but they do consulting and things like that as well. And then the Institute, the International Institute for Restorative Practices, have amazing trainings that are specific to school staff. They're online and they do it as a small cohort, and you have to make it to all of them. But they're really in depth. They're really meaningful. And I would highly encourage I find them very reasonably priced. We have sent our entire student supports team to them for the Institute, the International Institute for Restorative Practices, and Wichita has actually, as a district, contracted to work with the IIRP as well. So they might be a good resource to hear how that is going in their rollout as they do that as a cohort model. And one of the other paradigm shifts that we're slowly starting to do as we roll restorative practices as a framework out in KCK is reshift and rethink of ISS. And so in our middle school and high schools, our ISS monitors have been reshifted to be restorative facilitators. And there are people in the building that are getting intensive training from the assistant director of student supports and getting a lot of really rich resources at many of our high schools. Not all of them. Our deans of students are now dean of students / restorative facilitators as well. So there's another person on the admin team in addition to what used to be our ISS monitors who are having a voice and empowered to say, hey, let's look at it through a different lens. Don't forget, we can do this, we can do that. And so one of our high schools is in the process of setting up a youth court through all of that. They're in, I believe, their 3rd or 4th year of implementation. But the Center for Conflict Resolution, KIP Core, and the IIRP are great, amazing resources to take the Hannigan and Hannigan work and pull it into what it looks like into reality. Yeah, ISS is in school suspension.
That's outstanding. Thank you.
And I'm going to tag on to take this at another level. So right now we're talking about the school-based level, right? Like, this needs to move beyond that at some point. We know evidence shows it is proven zero tolerance policies, exclusionary policies do not work to help students grow and learn and develop. That's just the bottom line. They don't help anyone in a school. And so how we can get these behaviors addressed in helpful ways that it's not leading to exclusionary policies, might even be something that needs to be taken at a policy type level, whether that be school board policy levels, whether that be legislative policy. It really is important. And there are states that have modified their legislation to remove zero tolerance policies.
Shanna, I also think that you bring up a really good point. You can't have people attempting to enact a system when the system itself hasn't shifted. So eating that elephant one bite at a time, a small look for is how do you create a 3 to 5 year plan to shift your code of conduct? Because that is the handbook that people use when saying, oh, if this, then this. And so that is something that KCK is also working on. And we've got our first steps. Like I was talking with John yesterday, K through 2, we don't suspend unless it's imminent danger, like to self or others. That is truly, we say these kids are staying here and we're going to attempt to teach where is it, what is it, and how do we pull the families into it. But K through EC through 2, we're not suspending if at all possible. Like unless I'm dying, like it ain't happening.
I'm an elementary school counselor in Southeast Kansas. And so I agree, elementary schools right now, we are seeing an influx of behaviors. And I really feel like it comes down to parents too. Bringing in the family is a big piece of it. During COVID, when we shut down, like, I think a lot of our students got placed on technology, and as a way to, like, and the parents' coping skills, parents, like, it's hard for everyone. We all experienced some form of trauma throughout COVID, and like, we're seeing parents weren't able to cope, and so kids learn from their parents, and they don't know how to cope through these things too. And I feel like it's coming back to, like, these parents formed these coping skills, and it's just a cycle. And now we're seeing the kids that aren't able to cope either, and now when they come to school and they get frustrated with a friend, or they are under the table and they kick their shoes off, or they're becoming more violent. And so a lot of it that we've tried to do this year is learning more about the brain and how the brain works and what is behind those behaviors, like what's causing that underlying piece of it. Because it may be that they're just hungry and they didn't get breakfast in the morning is a piece of it, is a piece of the puzzle. Like, there's just little things, that compounding stress, that looking at and kind of explaining to the teacher about looking for that first sign of that stressor and being able to give the student a break. Movement is a huge thing that we've learned this year for our students, and adding in more movement into the classrooms. And what kind of movement, because not all movement, like Go Noodle, doesn't work for everyone. So it's different parts of the brain work with different movement styles, and teaching that to our teachers has been a really big thing. Also, like, we're looking at teaching our teachers about the window of tolerance and how stress impacts them, and how they are, that co-regulation is a huge piece of it. If our teachers don't feel regulated or don't feel safe when they come to school themselves, then that reflects right back onto those kids, and that can set kids off too. So that co-regulation piece, and focusing back on our teachers and making sure that they're okay, and what can we do to help you, because it's kind of like a mirror. Like, whatever the teacher is going through can be mirrored into the students almost too, is what we've learned a lot with the brain. So I and I'm not quite sure how, and maybe Jane has some great ideas of how we can pull families into looking at coping at home. And I feel like those families that we really need to reach are the hardest ones to get to sometimes. But appropriate, good coping skills at home, so we can, like, if that's happening at home, then hopefully repetitively it will help, and we can see that with the kids. But it's kind of a never-ending battle right now. But really, just for us, we're trying to educate more on how the brain works. What can we do, looking behind the behaviors and really seeing how that can help.
Misty, I'm so excited to hear you talk about that, honestly, because you're so correct. You know, if we don't take care of our educators, we're not taking care of our kids. I've actually started an educators group with just volunteer teachers that want to be a part of it, and they're taking their plan time to do this. This is completely voluntary, and it's just an opportunity to help them be valued, to connect with others in our building. You know, we're a building of 2,000 kids and over 200 educators, and they have said, even though there's all these people around me, how alone they feel. And so just give them some opportunity to feel safe and be heard, and to learn about co-regulation, because we're using Dr. Lori, excuse me if I say this wrong, DeSanto's book and her videos, and we're going through it pillar by pillar, and it has just been phenomenal. As a matter of fact, they want to continue it into January. That's what's exciting. Like, they see value in it. So yeah, thank you for sharing that.
We're also going, we have a book study with her book as well, the I can't remember.
Connections over compliance. Yeah.
Yes, exactly. Mona de la Hook has a really good Beyond Behaviors, and then there's another one, Robin Gobble, I think is how you pronounce it. She has a more parent type of, she's a therapist, but puts it in a parent perspective of looking at how the brain works and functions. But it can be transferred to teachers too, and it's really great information.
The Polyvagal Institute has a Polyvagal in Schools course that Dr. Lori actually leads. And it's pretty inexpensive. I'm not going to say it's cheap, but it's inexpensive. I think it was $300, but it's both asynchronous and live with her. So you log on to Zoom, it's like once a month for 3 or 4 months, and discuss some of the things that have been in the course. And it's literally all of her essentially applied educational neuroscience stuff that she does at Butler, but she's doing it for polyvagal for Dr. Porges. So that might be another resource or something, Melanie, that could be useful for others. And then,
sorry.
No, I'm sorry.
On Tazen, she has four videos that are free right now. So that's what we're using along with her book. So, but that's good. That's good to have another resource. And I'm actually applying to start her cohort this summer. I want to take her applied neuroscience and education certification.
You guys are really hitting the nail on the head. I was just going to say that a common thread I've heard among everyone seems like they're seeing that teachers, A, need to be taken care of, B, they need to feel validated and heard, right? And C, that the students need the same thing the teachers need. And so thank you guys. I mean, Melanie and Misty, and Tracy. Yeah, definitely appreciate it. I could see Cherie getting super excited about the neuroscience stuff since that's her baby.
Well, and yes, Dr. Desautel is someone that we partner with and have had her in. So Melanie, I'm excited to hear that you're using what is online. I believe you're referring to the Moodle courses. That's actually one that we have, as we've been struggling to keep up with building our online courses, is one that is a priority for us to go back and revamp to make it more interactive and have it be kind of meet the standards for best practices in online learning, which takes a little bit of time because you've got to be pretty tech savvy, but I'm glad to hear that that's useful, and we continue to partner with her. So hopefully we can help build on some of what I'm hearing today.
Well, a lot of great ideas people are sharing.
So I was going to say, Kathy, these are outstanding ideas. And I think if we could collect them in some manner and get them out to the School Mental Health Advisory Council and then have them available in some manner on a website for ideas of working with stress staff and working with students exhibiting behaviors, I think it'd be very helpful to the field as well, because you all are living it and you're delivering it. And that's what I was hopeful that we would hear today, is how are people successfully working with this? I realize that there are degrees of success and we're still within a tiered MTSS model where you still have students at tier 3. But this sounds like you've got a really good tier 1 approach and possibly a tier 2 intervention approach, and that you're working on supporting those staff and those students and those parents that are at tier 3. Because we seem to have had a heavy load in our tier 3 as we started this year.
Well, Kayla, if you could reach out to, I'd say Tracy and Melanie and Misty, they all had some pretty good ideas. And like Bert said, kind of get some of those ideas out to the council, maybe in a follow-up email. Those particular 3 shared a little bit of information right now. There may be some additional things that other folks have that we can include later. But right now, those are some great ideas as far as getting those out to staff. We may come back to this, but we have had Christina Mann pop on. So Christina is going to share some information with us about climate report. And I'm not sure how much time you've got. And I'm kind of guessing you want questions probably be put in the chat, and then we'll follow up as need be, Christina.
That sounds great. Yes.
Okay. So Christina Mann's with us, and we're going to turn it over to her right now.
Okay. Well, thank you for inviting me. I'm Christina. I'm a trainer on the Kansas MTSS and alignment team, and specifically with our behavior, social, emotional learning, or BESL team. And so I was asked to share some updates with you about the climate types report that we developed, how we're using it with schools, some of the feedback, kind of our role with that. And I don't know, yeah, it looks like I can share my screen here. Are you guys able to see that? Yeah, okay. So I will go ahead and just give a little bit of a context about Kansas MTSS, what we do, how we support schools, and our role is really to kind of scale up that professional learning for districts across Kansas looking to create, refine, improve their multi-tier system of supports. And as part of the BESL training team, our focus is to really help districts integrate the academic, social, emotional, and behavioral components of an effective MTSS. And we do that pre-K through 12. And obviously the goal is to enhance learning for all students, learning, well-being, all student outcomes for all students. And so we emphasize the importance of utilizing evidence-based curriculum, proven instructional strategies, and vertically align processes and procedures like database decision-making and so forth across the district to really create a coherent system of supports, systematic, and being able to rapidly respond to student needs. So our work includes face-to-face training sessions and online support, webinars. We bring in other experts. I'll tell you a little bit about who we're working with at the moment, virtual support, on-site coaching, and each districts get customized training to fit their needs and to best and most quickly implement their MTSS. So our work also includes collaborating with KSDE and other TASN projects and other entities like Greenbush to best serve our schools, and so that our framework can serve to align and enhance and kind of create that seamless integration for one system, the district's one system as they pursue their initiatives and outcomes for students. So that's kind of in a nutshell what we're here for and what we do. In the BESL, on the BESL team, our core really emphasizes a school-wide positive culture. And we see that as comprised of 3 key elements: relationships, strong positive relationships. And we talk about a lot of the things that I was hearing you all talk about here, like co-regulation and really understanding how that happens, how students learn to self-regulate is through that initially and ongoing as their nervous systems are developing across the whole window. They're with us in schools through that co-regulation experience, as well as our social emotional learning and structured expectations, those school-wide expectations. We know that academic, social, emotional development are just intertwined. They go together, and healthy relationships are kind of the vehicle for supporting this integration in a way that really maximizes learning and development. So we make sure we focus on creating that sense of safety and predictability, help districts really refine their expectations or norms. I'll talk a little bit about how we've used the climate types report to inform that and what some schools have done. And of course, we address those Kansas academic standards really for social emotional learning, because those skills are ultimately what enable students to meet and display those expectations by being able to understand and manage their emotions, maintain those positive relationships, and achieve their goals, make responsible, caring decisions. These skills and knowledge are essential not only for healthy development and mental health. I think Kent, I was watching on YouTube, was making that connection, between that social emotional learning and the mental health piece that schools are mandated to address. They're not only essential for that and mental health, they really are the human tools that we build and need for career, college, vocational success. So we work to bring these 3 things together. They share some overlap and have distinct characteristics, and purposes. They're the foundation, and without this, any interventions that we try to do are probably going to be a bit shaky, hard for students to generalize what they're learning in interventions, and could have limited impact. So we want this good, strong core. We want this flowing through all our supports and interventions. And a critical way to know if your school-wide culture is perceived as positive and integrates these elements in a manner that really meets your particular school population's needs is through data. And we can assess this with the school's climate data and compare that with implementation fidelity data and outcome data to really help guide us make those strategic decisions about where we're going to place our efforts and focus to improve all the outcomes we're looking at. So this climate data really became an important sense-making and coherence-making element that we were needing in Kansas MTSS. And so I developed the school climate types report based on the KCTC for our districts first. We've now, KSDE has taken that on in collaboration with Greenbush to provide these reports to all districts participating in the KCTC. It's now available within the KSDE authenticated application. And these reports are generated it's a one-page user-friendly report. And that's what I wanted to give some updates about and answer questions about and let you know what kind of feedback that we've been receiving. But I wanted to pause before I go into that, because I know we've talked about some of the recent legislation and so forth. I wanted to see if Monica is on here, if she wanted to give any kind of update about the KCTC, how that's going, participation rates, any impacts there to kind of give us some context before we look directly at this more narrow report for the climate.
Thanks, Christina. I'm happy to share today. I'm pinch hitting for Lisa Cheney and Rachel Phillips, who do the most work with our Kansas Communities That Care survey. But as you all know, with the changes in legislation late during the legislative session last year, there was some guidance that was put out that probably needed even more guidance added to it regarding how we survey kids in schools as it relates to consent from their family. And so we anticipated, as we administered the Kansas Communities That Care survey on behalf of KDADs, we anticipated we would see some decreases. We are using the same window that we've used for a long time of administration, and we opened up in November and will be open through the end of January for schools to take that. Based on initial registration by school districts, we have about 208 school districts that are registered, and that includes private school districts. We are down in the number of school districts that have registered. We're, probably down to about 82%, and we were usually around 90-ish. But the thing that we've been very clear with KDADs on is the ones that have not chosen to participate this year and have indicated to us it's because the difficulty in pivoting to their consent methods are very large school districts. And so we anticipate that we will be down on the number of surveys. So just for context, on a normal year, we might have 60 to 70,000 kids surveyed. We're hoping we get 30 to 40. Right now, as things are coming in, we are seeing school districts that a lot of them did earlier than they normally would. Smaller districts, but we anticipate a deep decrease in the number of actual students taking the survey. Anecdotally, we are hearing from school districts that have said no thank you this year. It is truly a logistical issue, an issue of clarity on what does all this mean in the bigger context of all surveys that we take within our schools. You know, KCTC is pretty cut and dried, but as we look at a school policy regarding every one of the surveys that we need to implement and move, we're putting everything on hold. There, of course, are the obvious negative impacts of this, but things that we're seeing from the field. We have community groups that have received funding from the federal government, either through drug-free communities or through PFS, which is another funding source, that are dependent on KCTC data from that is how they are measuring their success. So we are concerned about differing funding sources at the community level being impacted by this change. So we're going to keep everything live and going through the end of January and then shut it down and pull the data. We will again this year be able to turn that data around rather quickly, as we have the last 2 years, and we'll be able to report back to you soon.
Thank you so much. And I am sorry to hear about that with the logistics and the fears. I have such admiration for this data and this process and how schools and communities have been using this across Kansas for so long, and that it is such a respectful process for gathering information because it's anonymous and it's only annual, you know, and it really guides a lot of work, and we can be so intentional. So I'm really hopeful that those logistics can get worked out. I know that a lot of the districts that we work with were able to implement. Some did. The window, I think, is a little bit of because of the timing, the timeline within the legislation and that kind of thing. Put some rocks in the gears for how districts had been doing things. And so we're hoping that this dip will bring us right back up, because really we've been getting parent consent for the survey for a number of years now. And so some of those logistics I hope can be worked out very quickly. What we have done, though, is with the climate types report, taken this wealth of information that communities can use for so many purposes and boiled it down and focused it to one page to really address school climate. And we call it the climate types report. They are areas of climate that we need, that are important to address according to policy, legislation, and best practice. And the scales we pulled are those most profoundly affecting development, learning, and well-being, achievement, and performance in school. So it's very concise and focused to that school climate piece. We talk about the power of the report is in part because it integrates a lot of things that you guys have been talking about this morning, some really rich pools of research in health, mental health, and education. So the 4 climate types were chosen based on kind of integrating these concepts from the research. We've mentioned polyvagal theory, and those of us who kind of geek out about that and the neuroscience, we can connect those positive childhood experiences research, which is a little bit newer, with the adverse childhood experiences research that we've been talking about for a little while now, and the trauma piece with engagement that we really pull from through the self-determination theory piece for the model. So this results in 4 climate types. Empowering engagement is going to include student voice and agency, empowering relationships that are going to include teacher-student relationships, parent-student relationships, and then your risk climates for the depressed and the anxious conflictual, which pulls in some of those bullying indicators. So just so that you can see what's on the report in terms of the questions from the CTC that we pulled, these are the questions that are read into the little one-page report. And I don't know if folks got the little handout with the report on it. There's a report at the end, and we've also included some information from our BSOL repository. But in the depressed climate, these are the kinds of questions that we're looking at, and you can see at a glance if your data is much better than state average, if it's green, better than state average, if it's clear. That yellow color is kind of about right at state average, within a point or two. If it's orange, we're doing worse than state average. And if it's red, it's significantly worse than state average. So schools can see at a glance for their high school and their middle school, is this depressed climate, which questions are popping up? Is this climate type, depressed climate type, a hotspot for us? Are we seeing that our data is really worse than state average? Is it better than state average? The same with the anxious conflictual. These are the kinds of questions asked, whether students have been bullied, witnessed bullying, been electronically bullied, had property stolen, damaged, and so forth. And what we know from the research and what I've been sharing as part of my role with Kansas MTSS through several events at our symposium and at the KSDE Great Ideas Conference, and a couple of online webinars with Shanna, we know, and you all are probably very well aware of that those risk climates, that depression and bullying and whatnot, has a huge impact on learning. And this is just information from Hattie's, John Hattie, where he looked at a lot of meta-analyses to see what's the impact on learning. And we can see that depression and anxiety and bullying are almost like losing 3/4 of a year of schooling in terms of their impact on learning. We like to, if you're just rolling along with life developmentally, you're gonna learn some things on Hattie's dial that we all just kind of learn as part of life. And he shows where the impact on that is as far as the effect size, a little less than a 0.2 effect size. With teacher normal effects, we can get up to a 0.4. The 0.4 becomes that hinge point where if we pick practices above that, we really accelerate learning. But we see that with these climate types, their impact on learning is profound. So our risk climate types are really they help us address and monitor those things that schools are legislatively mandated to address: suicide prevention, bullying prevention. They help give some context to our risk screening process, which has been really impacted by recent legislation, as Kent shared earlier. And it gives us some context also for some of that early warning system data, like our attendance, course grades, and behavior referrals and whatnot. And we know that with our school climate report that we can now, every district that participates in the KCTC, we know from the Kansas data that it's negatively correlated with achievement. On the protective side, the questions, we talk about student voice and student agency and the empowering engagement. And voice is just understanding what intrinsically energizes students, their interests, what's meaningful to them. Agency is their ability to make choices and decisions and take action, influence their environment. And these are the questions that we pull from the KCTC into those climate scales. So I enjoy school, the work assigned is meaningful, important, things we're learning are important for later in life. My courses are interesting, I try to do my best work. And agency is really them being involved, even outside of school, them being able to have a chance to talk with their teacher one-on-one to impact their learning, chances for those class discussions and activities, and feeling safe. Like it's hard to feel like you can take action and impact your environment if you don't fundamentally feel safe. So those are the questions that load onto that. And then in the teacher-student relationships area, the questions are really around a lot in terms of feedback. What are those interactions like? Do I, as a student, feel like I'm praised for my effort? Do teachers notice when I do a good job and tell me about it? Do they let my parents know? Am I asked to work on projects? Am I able to use my voice and kind of participate in things that make a difference in my community? And then those parent-student questions, able to share their thoughts and feelings. They can ask for help with personal problems. They're asked their opinion on decisions affecting them. And again, like I said, I think the KCTC is such a respectful way of gathering this data because it is anonymous, and yet it provides us with information that helps us know whether we need to improve an area, provide a little more information about what students need, and so forth. And we know that these things also have a big impact on learning. So again, with John Hattie's information, things like enjoying school and having strong relationships and getting the kind of feedback we saw in those questions are really on past that hinge point. They really accelerate learning to quite a degree. And so we can see that the information on this little one-page report aligns so well with our state board goals, particularly those around all of the state board goals, but particularly those around social emotional learning, individualized plans of study, graduation, our vision for a successful graduate. It really aligns well with a lot of the TASN projects, with our KISA project, our KISA process, STAR recognition, and we know it's positively correlated with achievement in Kansas. So it's really powerful information as just kind of that quick overview that really helps us contextualize, if we're not seeing the kind of results we want on state assessment, what is our school climate from a student perspective looking like? Are there things we can do to improve that are also then going to bump up achievement? What does it look like in relation to our risk data? And so when I present this to schools, either when there are districts or at the events that I mentioned, it really, I had one superintendent come up to me and say, we weren't going to do the KCTC this year because of recent legislation and all the things that this kicked up. But after hearing this and seeing the connections and seeing how we can use the information, how valuable it is, how it connects to everything we're trying to do, I'm changing my mind. We're going to try to get those parent consents and get going on this. So I think it's really important for us to, as Kent and Shanna were saying earlier, help people understand and draw the connections between a lot of the things that we are asking schools to do, and we want to see increased achievement and the role that the data plays and how important it is. So this is really important data for guiding big level strategy for the year, and then seeing, are we seeing a difference? And then, that risk data 3 times a year really helps us navigate across the year. Are we getting there? Are we getting there? Are we meeting needs? And then the skill data also helps us see, are kids getting the knowledge and skills that we need? So we need this information, and schools find it really valuable. One of the things I was a little surprised about when I've presented on this is that outside of the Kansas MTSS schools, many schools were not aware that the climate types report was in the authenticated application. So we may need to do an ongoing awareness campaign. We did push that out, and Shannon and I did a couple of webinars, but it's just, I guess with anything new, there's probably multiple channels and multiple times that we want to share this out. The ones who did know about it were so appreciative of being able to access it. And then our schools, working with Kansas MTSS, were kind of able to get some of that data in the same year, because Greenbush shifted kind of how they were doing the data, and they really appreciated that. So I wanted to share that feedback. And they, like I said, they really valued understanding the connections. And so one of the things that we have now been working on with our schools within the Beasel team is really supporting them in learning how to work with these pieces of data together to set strategic goals and then be able to kind of monitor their progress. I will say that the other piece of feedback is that the timelines in the current legislation really seem to work at odds with the mandate that districts have to address needs around suicide and bully prevention. And so I think that's been very difficult for them. So I was just going to show you a little bit too about how districts are using the report. But I wanted to pause and see if there were any questions. I haven't looked at the chat.
I don't really think there've been questions in the chat. Somebody asked if you could share a copy of the PowerPoint.
Yes.
I didn't see any questions.
Yeah, and I don't have a question either, but I do want to thank you for your efforts. I will tell you, in Shawnee Mission School District, it's a large district, and we struggled with the legislative directives that sort of changed our approach, particularly around that 4-month window piece. We typically get all of our verifications during the registration process in late July, early August. And so with the addition of the 4-month window requirement, that kind of threw us off a little bit, and KCTC is part of those verifications that we do at the start of the school year, along with the Panorama Social Emotional Learning Survey. Any surveys really that we're going to do, are you agreeable to them on the front end? And then that runs throughout the year. So with the timing of not just KCTC, but also our second semester Panorama survey, we had to go back, figure out a way to get that consent from parents and guardians via Skyward so that we could run the report, so that we could then give those students the surveys. And it's not just KCTC, it's Panorama as well. And so, it took a lot of work. But I do appreciate what you're doing on behalf of schools and districts to try to make this, not just make the process as easy as it can be, but also to show the benefits of doing it. That has helped me sort of resolve myself to, okay, we got to kind of jump through these additional hoops and make this happen, but it's worth it. because the benefit that we get from getting this data, Bert and Kent and I have said many times in this group, this is the only statewide suicide data that we have. And it's important information, and we utilize that information and we share that information. So all that to say, thank you for your efforts from Shawnee Mission and from other school districts.
Thank you for that feedback. And I just am so grateful to Greenbush and Lisa Cheney and the team for partnering with us to develop the report in a manner that it can be used across the state for all school districts. And so, yes, I think that is just so vital, is making things user-friendly and making the process as fluid as possible with the least amount of friction, so that people can get the work done and support students. And so it's hard to see some of the bumps in the road, but appreciate the feedback, and we're going to keep plugging forward and working on this and making it move forward. So how our districts are using the data, I just wanted to kind of give a overview at a broad level, and then you can ask deeper questions about it. But like I said, this is a one-page report. It's very rich in information. So at the top part of the report, there's information about participation rates. So, I mean, we even just start there with our districts. If those participation rates aren't green, if they're not, outstanding, we talk with how can you improve your participation. And so examples that we give and that our districts have used are the resources that Greenbush provides. Number one, they have provided this great resource that just kind of talks about the legislation, what's required. There's links in it to get you what you need. So you can put the link on your website. You have a parent letter, consent letter. You have a way to collect those consents online. They really made it as easy as possible. So we share that out. Many of our districts have used that. And then beyond that, we really talk with our districts, and they have, some of them have started planning at least on how they're going to do that how important it is to share this information with parents. So the results of your climate report, being able to have something on your website, your newsletters, what have you, about how important the school climate data is, the power of student voice, that when we hear from students and their perceptions, we can respond, we can do something, we can engage them in creating solutions. And we know that there's such an impact of climate on learning and well-being. So it's a really important area, just letting parents know that. Helping parents understand what your plan is for improving school climate based on this anonymous data can go a long way to having your community both understand it and see that you value it and see what you're going to do about it. And it makes it a little less mysterious. It allows us to kind of all wrap around our kids and get on the same page. And, even providing information about those positive childhood experiences, how they are things that span from home to community, and inviting adults to work together on making sure we're providing enough of that to really impact students' health and learning. And so when schools understand some of that, there's a resource that we have around family engagement that KPERC developed in collaboration with the TASN projects to really help parents understand what positive childhood experiences are and why They're so impactful for learning and health. So we have resources that can really help bump up both the support for this survey and the participation rates in the survey. So that's some of what they've been doing. The other thing is, as I mentioned, each of these scales are banded by blue. So you have your depressed climate scale, your anxious conflictual climate scale, and then your empowering scales down here. You can see at a glance at your high school level, at your middle school level, what your hotspot is. And then choose strategies and strengthen your core to help improve that. So I'm just going to give a real simple example here that relates to our core. And when we train around relationship, social emotional learning, and clear expectations, we help our schools understand that there is huge power in simple actions consistently implemented. And so choosing those, doing them well, maybe even collecting some data on how frequently and how well you're doing that, can really move the needle on some of this data. Some infographics that KCTC provides are things like when teachers acknowledge students and notice they're doing a good job and let them know about it. That 2021 KCTC data showed that students try hard to do their best work at school 11% at an 11% higher rate when teachers notice that they do a good job. So that do their best work at school is part of that student voice scale. So we see that these things start to impact each other as well as the academics. So again, we're talking about that academic, social, and emotional relational piece is so intertwined and impact each other. So a simple practice like acknowledging, noticing when students are doing well, noticing things that they're doing well, also works in the other direction. 14% fewer students reported feelings of depression in 2021 when their teachers notice they're doing a good job and let them know about it, compared to schools where they felt like that didn't happen. So this one item in the teacher-student empowering relationship scale has impacts both ways. This is why it's core and why it's so important. And it can be easy to get busy or discount, these kinds of simple but profound practices that are part of co-regulation. They're part of that feedback loop, that piece of helping students learn what's working and what to repeat and what's valuable. So small things can have big impacts. So we talk about this with our positive feedback continuum with schools. That's part of what they implement within Kansas MTSS. Some other strategies that our schools have adopted looking at this data and noticing when either that risk climate for depression is high or maybe the relationship climate is a little low. They do things like the relationship dot activity. You guys might have heard about this, where you have your list of students and staff put a dot next to the students' names to whom they feel like they have a strong connection, strong enough that they feel like this student would come to them if they had a need. And then you see if there are any students that aren't connected, and you intentionally make connections with those students so it's a way of really making sure that every single child has a good, strong relationship with an adult at school. And then they implement what we call a 2x10, which is just being very conscious and intentional about just 2-minute interaction a non-contingent, just talking about something that that student cares about for 2 minutes, 10 days in a row, to just kind of jumpstart building that connection and that relationship. I've also had some schools do the reverse relationship activity, where they actually asked students to say, who do you feel connected to? Do you feel connected to anyone? And if so, who in the school? To make sure that every child feels connected. And then if a child is not saying they feel connected, they can still do that 2x10 strategy. If for schools where the bullying data, the anxious conflictual climate data is looking a little high, I've had schools then take that the next step and do a student focus group or leadership group and say, hey, this is what you guys are saying. What do we need to be doing differently? What would be some strategies? What are you seeing? I've had schools, even like at the secondary level, recognize that when they do their school-wide expectations, just sharing expectations may not always be accepted by students. They actually engage their students in helping create the expectations. What should this look like? Instead of bullying, what does bullying, look like? And instead of that, what should we be seeing instead? What should we be doing if we see it? Engaging students in kind of developing those lessons and those expectations and using their language, their voice to create those, especially at the secondary level. Really some fun things that I've heard schools say, and excitement I've seen from the educators about how engaged the secondary students got in creating those things. They thought they might just kind of blow it off a little bit, but they really became engaged and they really had conversations with each other, and they did a good job of kind of getting out in small groups so everybody could talk, and then bringing them back together and those kinds of things. So they really use this information. We've had schools then decide to amplify certain SEL lessons that might be most relevant. If you are having problems with bullying, which tends to be the thing that happens at maybe the middle school more often, those SEL lessons around assertiveness skills, upstander skills, problem solving skills, all of those kinds of things. And I've listed some other examples here of the kinds of strategies then that schools pick up depending on what's showing up as risks within this climate data. So I just want to pause there for a minute and see if we have any questions, comments.
Christina, I don't know how much more you have to do. We are a little bit on a tighter schedule. It's great information. I think everybody's really enjoying it.
Okay. Well, I will wrap up then with just saying that one part of what we've also done is develop additional resources and supports for schools around this. We have a lot of information at our Kansas MTSS and Alignment BSL repository, and the link is here. Of course, there's lots of information with kctcdata.org, where you can sign up for the survey, and KSDE has information on their social emotional growth page about all of this. On our repository, there's a page dedicated to the school climate types report. You can click for a sample of the report. We keep track of frequently asked questions and update that on that website. We've got a link to Greenbush guidance on here. We also have a basic 411 fact sheet about it that anyone can access. Let's see, and we have a video that helps describe how schools can look at the data and make some basic decisions about what to do about the data. And we have resources related to events. So we've done things with at our symposium, things with KSDE, but we also have an event with, where did I put that? Oh, here it is. Because student voice is an area that tends to be lower, especially at the high school level. We're doing a series of webinars and live events with Dr. Russ Qualia and Dr. Lisa Landy on student voice and aspirations. They have been fabulous, very well received at our symposium and at a couple of live events that we had in Wichita and Hayes. And so there's still time for folks to sign up for the webinars that we're having, and then we'll have another live event in April. So doing what we can to support this, both with our school districts and then through these kinds of things with districts beyond those that have signed up to work with Kansas MTSS and alignment. So all of those resources can be found on our repository, and that's kind of what I have in a nutshell, if there aren't any other questions.
Well, thank you, Christina. A lot of really good information there. And Kayla, if you'd make sure in a follow-up email that you get Christina's email, or excuse me, PowerPoint sent out to everybody, because I know some people were looking for this information and really going through and probably want to follow up with some links and stuff that you put in the PowerPoint. I think that'd be real helpful to people. Christina, we really appreciate your time, and I know our numbers, we kind of expected them to drop this year, but usually we have a way of working to try to figure out how do we work with what we have and get those numbers back up, because this is good data and it's helpful for our schools and for our kids, so we can make adjustments and do things that we need to do in schools. So unless there's any further questions for Christina, I'll go back to Shanna, and she's going to follow up with a couple of things.
Sure. So first I want to say thank you to Christina. I've gotten to watch her present on this so many times, and every time the room is just filled with knowledge, and I learn something new every time. So thank you for being willing to share with us again today and keep us all focused on what's right and best for kids. I have just a couple of things as we wrap up that I think you're going to want to know about. I am going to screen share. So first, I am going to show you, just wanted to point out on our School Mental Health Advisory Council page, we have had some expressed interest from the community on people joining the council. There is now a link to the application directly on this page, so that they can apply, and as we have open seats, we can then select from these applications for that. So if you have anyone ask you about it, that's where you can find that. Additionally, on several of our KSDE pages, we now have added this whole little piece about the suicide resources in Kansas, so that they're in many, many spots on the KSDE website and handy to people. Okay, the next piece is Kathy, the council wanted to collect feedback from the field on legislative changes or changes this year. We did not specify exactly what changes, except I did say in the survey, non-academic surveys, and asked for feedback. It was open for 2 minutes, and we had 3 responses that were really in depth. It was open for 2 hours. We had 40 responses. We're now at 108 responses. Most of them have been about 75% of them have been by school counselors. I don't know why I have 2 lines on there, but they're the same thing. And then you can see we've also sent this out to homeless liaisons. We sent it out to social workers, and we sent it out to counselors. We have had administrators respond to this, even though that was not an audience that we sent it out to. So I thought that was something to note, an interesting piece of it. I am going to try to be very unbiased and objective right now while we take just a brief glance at this. I'll read you just a few of the very first ones that came in so you can kind of see the direction that they mostly all went. And then I have some keywords that I thought we could just do a search for and see what those bring up. So the first response says, this bill's the worst. I had no support from Kansas and literally hundreds of pages of testimony against it. This legislation was not putting Kansas first or education first when they voted to pass this bill. It impacts my work daily with students, undermines my professional qualifications, and operates on the premise that I cannot be trusted to use my judgment or how I progress, monitor, gain support, and gain constructive feedback from the clients I work with, the students themselves. Another one, if we drop down to number 5, we've seen a dramatic decrease in the participation in the KSDE survey. Getting parents to respond to give permission in the middle of the semester was a huge challenge. Our data is going to look drastically different this year. It continues to be, I'm going to kind of go through it slowly. People talk about specific assessments that they are not doing anymore, or that they've had to do differently. There were about 3 that really said that they were neutral on it, no impact. Out of all of them that I read, I didn't perceive any of them as being positive. They were either all neutral or somewhat negative. I think how districts have chosen to interpret to the legislation has been clear in here, that there's different ways. For example, this one indicated teachers and students are frustrated because they can't take polls. For example, a journalism student couldn't send a poll to their peers asking them what their favorite Disney movie is for an assignment or news story. So I think that goes back to kind of that guidance concept that we've talked about. There's another neutral one, but there are 108 responses. I did some searches, and if anybody wants to give me a word that they want to search for, I did suicide because I wanted to see. So 27 of the responses included something about suicide. This one, the first one that popped up here, says legislative changes are ridiculous, especially having to call parents before doing a suicide assessment. That's just not how things work when you're in that situation. This was under the question of, is there anything else they would like for the council to know? Let's see, another one, suicide scanning and threat assessment screening. It should not be part of the items we have to ask permission for to administer. It continues on. Another word that I looked at was job, because I noticed it was mentioned a lot. So 15 times people mentioned about being able to do their job, or being worried about losing their job, or doing their job in an unethical way. So that was pretty notable for me. And then data. There was a lot that talked and referenced their data, 39 of the responses, and many of those were specifically tools that we have promoted, as good practice, the Panorama and FastBridge, and these tools that we know are helpful and good for kids, as well as the KCTC. So
Tamara
yeah.
asked if you'd put the word family in and see what you got.
Absolutely. 4. Yeah, so this one, yeah, there were several though that kind of got to family as I was reading them, more on a basis of as they're trying to work through student issues that may be associated with the family. So self-harm was one that I looked at, and the connection was made between, contacting a parent about self-harm, but then the child doesn't want to talk about it because it's maybe something to do with the parent themselves. And so the lack of being able to practice the therapeutic practices that they would normally be able to do. Are there any other words people want?
I haven't seen anything pop up.
Okay, so at this point in time, and I'm going to be very clear, the survey is not from KSDE. The survey is from the School Mental Health Advisory Council. The data is the School Mental Health Advisory Council's data. It's not KSDE's data. So I'm just going to leave it with that and let Kathy take it from there.
Yeah. I think I'm going to go back to something I said earlier. I do think that probably the best thing for folks to do when they advocate is to really talk with your individual legislators. I think that's where we can have an impact. I don't know that we can have much of an impact with leadership on this issue, but I think with individual legislators and your people that you know, I think that would be a good opportunity for you to use your advocacy skills and your advocacy networks to share with folks the value of this data as you go through your day and working with students, working with families, just all the children, what you need to do and what you need to get taken care of as far as school is concerned. Because, the CTC data is extremely helpful. There's other data that's helpful. And just to get your story out there of how this information impacts what you do and how you can be effective with children, I think would be what right now, my best suggestion of how to advocate. We are a strong group and we have strong networks, and I think you can share with folks. I don't know where this legislation will go this year. It could even get more restrictive. I mean, that's the reality. So I think it's a good idea to have some conversation with folks about that, about how valuable this data is, and the roadblocks that the 4-month guidance and other things puts in there. So I would really suggest that we go about advocating and letting folks know, letting our legislators know, what the value is of these surveys and everything that we benefit from in the schools. We're not trying to take parental rights away. We're not trying to do any of that, but it is, the reality is it's out there, and the reality is it could be brought up again this year by legislature. I don't know. Christina, do you have a question? I see your little hand up.
Well, and this may have already been stated, but your point about the value of each of the data sets is so important for them to understand that some of this deeper data dive that we get through the KCTC is awesome. It's anonymous. It's annually. It can guide our broad strategies. But the timeline issue for our screener 3 times a year is that's how we discover who might be experiencing risk at any particular time and able to intervene. And when that timeline on there is within this 4-month window, our schools can't do that the 3 times a year. So helping people understand kind of the difference, that screener is individual level data that helps you respond to student need and prevent things getting worse and possibly progressing to that level where we're seeing the suicidal ideation. I'm sure you guys have already discussed that, but it's making it very difficult to find the risk and respond to the need.
Yeah, very, very true, Christina. Thank you for that input. I just think we need to be realistic about what we're dealing with in the legislature right now. I don't know. I guess I'd say watch who you vote for. But and what the agenda is of some of those folks that is maybe can make it difficult to do some of the things that we do. I don't know. I'm trying to be correct on what I'm saying here. So, but I do think that individual advocacy is a great angle to go and to work with, because I think we're going to continue to be under. I would be surprised if the 4-month window thing will change anytime soon, is what I'd say. And I'm not connected as politically as I used to be. So, but just so you know, but that advocacy is, I think it's important, and those stories are important. So, but thank you. And again, Christina, thank you for your presentation, and thank you for the information that you have given us. The CTC survey is such a good survey and provides such valuable data to folks. So I'd like this. It needs to continue to be valuable, is what it needs to continue to do. Shanna, anything else on this particular agenda item?
No, sorry. I feel like I left everybody with a big downer.
That's okay. All right. It's more to come on this topic, I'm sure. So,
but I think that the message that Christina relayed about that the impact of this making it more difficult for whether it's a classroom teacher or a building principal or a district to identify risk for students and then intervene and provide the supports that kids need. And that this makes it more difficult to do that. That's an important message.
Yes,
regardless of
totally
what
agree.
the source is.
Yeah.
It's making it harder.
Yep.
And it was hard to start with.
Yeah, true. Okay, I'm going to go ahead and move forward. We've got agency updates. I don't know if Bert's still on. I don't think there he is.
Yes, I am still on. I gave my agency update really about the behavior challenges, that we're facing. I think that we're also looking at academic achievement using the state assessment as the measurement tool, and that the agency is concerned about the number of students that are scoring at level 1, which is the bottom level. And so there's an emphasis on trying to raise the top half of level 1, which is quite a few students, to be frank. And so how can we do a better job, since the legislators across the street seem to want to measure us on that single measurement tool? And we know that in 2 years, we'll have a new assessment. So there's going to be a lot of political melee about where we set cut scores, because many people think we set the cut scores too high on this last assessment. And that's why students aren't performing at a level that is acceptable, if you will, within a upper 2, 3, or 4, because we only have the 4 levels. So there's been a lot of conversation here in the agency about that. Another conversation is the Division of Learning Services is looking at school improvement work, and how can we promote those practices that are going to lead to the best outcomes for agencies when they're identified as not meeting benchmark. And so we've got TASN involved in that process, as well as all of the Division of Learning Services teams. And we are working on ideas that we could promote and support agencies so that we have better outcomes that they can achieve. So those would be my updates at this point in time. We do have a special ed webinar tomorrow with the special ed administrators in the morning. We do this monthly. And I'll be talking about prevalence data for special education because it's going up. And I'm not going to try to predict why that's happening, but we do have a lot of openings in the state. There are 1,600 open teaching positions in Kansas right now. 385 of those are special education positions. Now, if you don't think that's impacting instruction and learning, then I need to take you to class on Philosophy of Education 101, instructional practices, talking about the pedagogy that people need to be effective as educators. And when you put people that have substitute licenses, who may have had a little bit of practice in a classroom or two, and now all of a sudden they're the lead teacher, do you think the outcomes are going to be stronger or weaker? It is a concern to the department. It's a concern for our students. It's a concern to parents. So just putting that out there that we need to do a better job of recruitment and retention of our special educators and our educators overall in the state. I know that I've heard some, well, I don't know what I'd call it, it's rumor, that many social workers and counselors will be leaving their positions at the end of the year. They're very frustrated over the restrictions that House Bill 2567 put on them. I hope that's not true, but time will tell. But those would be my updates for now. And again, not to be like Shannon and leave you on a downer, I do want to remind you that we do have a holiday coming up for many of you. And that I hope that whether it be Hanukkah, whether it be Christmas, whether it be winter break, that you're able to achieve a little bit. Oh, I love that baby right there. You're able to achieve a little bit of R&R because you've earned it, all of you. And that was a beautiful picture, Shanna. So that's where I'll leave it, Kathy. I don't want to spend all day because I have a list that's 2 arm lengths long, but those are the highlights.
Tamara requested a picture as a upper for the end of the
I
meeting.
love that. That was
Great.
definitely an upper.
That's great. Okay, any council member updates? I know a few people have had to pop off because we went into lunchtime. Anybody?
Kathy, I'm sorry, I had to join from another meeting. If I could just give a real quick update as
Yes.
well. So MHIT, our mental health intervention team program, is going into our progress report for semester update. Our portal shows that just this semester alone, we have served over 4,300 students here in the state of Kansas. That's a fantastic number of kiddos that are getting the support, the therapy that they need inside of schools. Saw a really awesome stat as well that says that if a student receives mental health services inside of a school, they're 6 times more likely to complete that service. That's fantastic. Also want to put in a plug. I will try and send out a flyer. Our Safe and Supportive Schools Conference is at the end of January 2023, the 30th and the 31st of January 2023. It will be in Manhattan, Kansas. $75 to register. We have, I'm a KU guy, but we have Coach Bill Snyder is going to be our ending keynote. I think that's pretty cool. My cohort, Jim Green, has done a fantastic job of putting this together. He's a K-State guy. I'm going to let him introduce Coach Snyder at the end. But I'll put this flyer in, see if I can put it in the chat. If not, you'll get emailed. Please invite everybody. We're trying to make this as affordable as possible so that everybody can come and get some really great information. So I appreciate what you guys do, and thank you for allowing me the time to speak.
You bet. Any other updates, either agency or council members?
We have a quick update from, I believe it'd be on behalf of the School Counseling Association, School Social Work Association, but we are planning the School Mental Health Advocacy Day at the Capitol for January 26th. So that would be a great opportunity for people to join us. I just dropped the registration link in the chat for people. It is tentative because technically we cannot register for the space until January 1, but we're planning for January 26th and they know that.
Okay, very good. Any other updates?
I listed
Kathy?
the KCA CASCA conference as well. That's March 9th and 10th in Topeka. And you don't need to be a school counselor. community counselor to attend or present. We just have so many valuable resources and agencies on this council. It'd be great to have a variety of you presenting or having at least a table at a conference. Thank you.
Great. Okay.
Melanie, is there a
Somebody
link
else?
to that?
John?
I posted one earlier.
Okay. In our chat?
Yes, I did.
Okay. Okay. I'll grab it. Thank you.
Any other updates or announcements from the group?
And Kathy, I just noticed, and I don't know when the settlement came down, but it was actually a settlement with 30 or 20 states with Juul vaping. So Kansas will be receiving about 9.9 million over the next 6 to 10 years. And at least what I read said that the monies will be dropped in the state general fund and they're not allocated yet. So I go back to that first presentation that we had on overdose deaths and how vaping and other things can be gateway activities that people get into to the higher level drugs that cause death. So it might be an opportunity for us to be involved with trying to shape how those dollars would be used in a way that is really effective and helpful for schools. So I just throw that out.
Good point. Thank you. Thanks for watching that. Anybody else? Updates?
Save the chat. This is one of the most greatest chat I've seen with I can go back through it.
Yeah, there's a
Almost
lot of good
resource.
information in there.
And then there's an updated link for this conference if that one didn't work.
Okay. Anything else? Anything future agenda topic ideas? I definitely think we'll probably have a follow-up on the presentation that we had today on the overdose dashboard. So we'll have some follow-up on that. But any other items? Okay, seeing none. Lots of conference links in the chat. So anything else? Okay, well, we went over a little bit, but that's okay. We actually are under the original time, but we did go over a little bit. So we'd just like to thank everybody for attending. And as Bert said, with the upcoming holiday season, hope you're able to get some time off and enjoy family and friends and a little R&R as we go into the spring semester. We always know that brings a lot of great new opportunities. And I know everybody's working hard with kids and hard with teachers and your families and your parents, everybody that's part of your school community. And such important work that you all do is just, commend everybody for the hard work that we do. And we've got to keep everybody's spirits up and working hard because the work that you do is second to none. So I truly believe that. So thank you all. And at this point, I'm going to adjourn the meeting. So thank you very much.
Happy holidays, everybody.
Yep. You too.
Take care, everyone.